Good afternoon, and welcome to the bill hearings for the House and Health Government Operations Committee. It is 2 o'clock, and we're going to begin our bill hearings. I'm Chairman Jocelyn Pena-Melnick, and my Vice Chair is Chair Ariana Kelly. This is our first session back in person since 2020, so I ask for your patience if we encounter technical or streaming issues because we're having some witnesses that are virtual, some in person, and it does take a little time for staff to make it work. Please set your electronic devices to vibrate and don't hold conversations in the committee room while testimony is happening. If you need to speak, please go outside. We're going to hear from the bill sponsor and the sponsors panel, followed by an all in-person witnesses. So we'll have people that will testify favorable with amendment, and unfavorable. Then all virtual witnesses will do the same. The bill sponsor testimony is not limited, but please don't take 10, 20 minutes. Be sensible. While all witnesses will have 2 minutes to provide testimony. A timer is displayed on the screen and a sound will be played once your time has expired. Please adhere to our committee rules of 1 question and 1 answer from the panel, not 1 question and 1 answer from each witness. Please keep your questions brief. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website and YouTube. And today we will have the following bill order. We're going to start with House Bill 611, okay? And then we're going to do House Bill 19, House Bill 26, and the last bill of the day is House Bill 103. We do have a briefing schedule on the Maryland Department of Health budget overview at 3:30. So if we're not done with our bills, we will have to stop, do the briefing at 3:30, and come back to the bills, okay? And as a courtesy, I like to remind everyone of our witness guideline because we have had a couple of issues. And from leadership, the 2023 House protocols, it says that on the day of a bill hearing, witnesses may not alter their witness status from providing testimony in person to virtual or from virtual to in person. So please don't ask staff. We can't do it. It's the rule. From the HGO guidelines, and these are posted on our page and on the MGA website, oral testimony sign up and written testimony submission is open 2 business days before the scheduled hearing between 8 a.m. and 3 p.m., 8 a.m. and 3 p.m. The name you use to sign up with during the sign-up period is the only name that will be called and allowed to testify. Please sign up as favorable with amendment if you have a suggested amendment on your bill. And these apply to members and witnesses. And the most important thing here is that if you have an amendment, you must make sure that our committee gets it, because otherwise we cannot consider it in subcommittee. And who do you turn that amendment to? To Michelle Furman, who's a committee secretary. Make sure that your amendments are submitted to Michelle. For the bill sponsors are automatically signed up for in-person testimony on their bill, but must follow the same procedures and time frames to upload their written testimony. So please don't ask staff that you're late, that you're gonna turn it in, because what happens is that it makes life really tough for them, and they have a lot of work already. So please work with your witnesses to ensure they are aware of the witness guidelines and sign-up procedures. If you have any issues, please contact the committee as soon as possible if you have an issue signing up. It is much easier to help you when the sign-up window is still open. And this is what's really important, because this happened yesterday, and it was my fault that I allowed someone to testify whose name was not on the list. And I didn't know this happened. So after the witness sign-up closes, it places an incredible burden on committee staff to accommodate late requests and changes. You know what happens that I didn't know? They must manually make changes and upload the documents, reprint and reorganize the documents if we do one change. So please be respectful of their time, because Michelle left close to 11 o'clock last night. So if we could just be thoughtful, if you don't get it in, it doesn't come in, okay? There are other witnesses as well. And I say that with a lot of respect. So we're going to start now with House Bill 611, and that is Delegate Kelly. And this is the State Board of Nursing Sunset Extension licensure exceptions, and board operations and membership. Good afternoon, Delegate Kelly. I also want to take a minute to welcome the Secretary of Health, Dr. Laura Herrera Scott. Welcome to the committee. Delegate Kelly, you may begin.
Thank you, Madam Chairman. So I'm just going to introduce the bill, and I will then pass it off to the panel of experts who are here with me. But I would like to just talk to my colleagues on the committee for a minute. For the new members, you may not be as aware of this issue as returning members are. This is a hard issue that we're about to deal with, but I am hopeful with the plan of action that I am coming to you with. So many of us who are returning members on the committee are quite aware of the numerous challenges that have been facing the Board of Nursing over the last many years. And I have been working with the chairman and many others on this committee to try and come up with a plan that can help us make sure that the Board of Nursing has all of the resources that it needs to provide the important service that it does for the people of the state of Maryland. I really want to say that I'm so hopeful about the plan I'm about to present to you, and I want to really convey how much respect and appreciation I have for everyone who's involved in this, as well as the folks at the Board of Nursing who have been working really, really hard under very difficult circumstances the last few years. And so I am hopeful we have a great plan, and I am thankful that you're taking the time to listen to it. With that, we're going to dig into some of the harder part. I just want to read some of these things to you. I'm writing again on behalf of a new graduate who has been patiently awaiting her license. Blank has sent in all the necessary documents, presented herself to the Board of Nursing office on 2 occasions for follow-up, only to be told to be patient. Her university sent in transcripts 3 times as they expired while waiting for clearance. Blank was told last week she would be cleared by close of business on Friday, but the license is still pending. She's spoken with the governor's office. As was pointed out, her potential employer is anxiously awaiting notice, and the new graduate has been on alert that the job will be given to someone else. New person. I'm writing to see if you can intercede to assist. She has made an application in early July and went to the Board of Nursing recently in person in hopes that it would expedite the process, only to be told it would take an additional 10 weeks to obtain her license. She's in jeopardy of losing the position she contracted for upon graduation. Any help would be mostly appreciated. New person. Does anyone have any tips on speeding up the Maryland Board of Nursing? I was supposed to start my first position next week, but I'm unable to still because I don't have a license. I just don't know what the holdup is at this point. No one phoned me. I've sent several emails to the Board of Nursing without any response. I've tried to call them and I never get through. I just wanted you to know I'm still without a solution. New person. Hello again. I've sent my timeline of events to multiple authorities, including Delegate Shane Pendergrass, Chair Emeritus, Health and Government Operations Committee. I've not heard anything from the board, and my license is still not issued. Do you have any suggestions for what to do next? I'm so frustrated. I'd like to remind you all that we have a critical nursing shortage in the state of Maryland. New person, I would like to ask for your assistance in dealing with the Board of Nursing. I am reaching out again because I've had difficulty reaching anyone at the Maryland Board of Nursing to follow up on the status of my license application that was sent in June. I'm hoping someone can help me connect with an individual who can assist. I understand the processing may take up to 12 weeks, but I've had no correspondence or replies from folks with the board, and I am concerned. There's something else I must do. I did note that my check was deposited, indicating that my packet was successfully received. New person. I have emailed the renewal department at the Maryland Board of Nursing 7 times over the last few weeks with absolutely no response. New person. For almost 6 months, I have been having issues with my Board of Nursing license renewal. I've reached out weekly via emails and phone calls and have yet to hear a response. I'm at the point where I cannot sign for samples in my office, and I'm concerned the insurance companies may reject claims. I recently changed my name and submitted the proper paperwork, and the name change was reflected in less than 24 hours. But my license is still shown as expired. New person. I'm desperate to get some answers regarding my renewal. I've emailed the renewal department of the Board of Nursing 7 times over the last few weeks with absolutely no response. New person, any hints on what to do about renewing my license? The Board of Nursing have a second copy of my certification and still no word except their email auto reply of being busy. They don't answer the phone. I'm almost done, I promise. It could go on forever. I just want to convey a couple more themes here. Someone finally answered the phone at the Board of Nursing on Friday afternoon in late October and told me it was a mistake because they weren't supposed to answer. And they informed me that I couldn't renew until I filled out a change of residence form under the information tab on the website, which I had submitted. I emailed weekly, and I logged 12 phone calls without an answer. I asked my hospital if they had any connections, and they said that I'd have to take a day off and go in person to try and figure it out. I emailed my state senator and 2 representatives who were both members of the Health Occupations Subcommittee. I received an email and a phone call within days from the Board of Nursing after that. I returned this past Monday for fingerprinting because now my license is expired, and I had to pay another $50 for that. I'm still waiting for my renewal. It goes on and on and on. This person is pointing out that they are licensed in Florida and they're thinking they'll go work there because they can't figure out how to work here. Thank you for taking my call today. The issues I and many others am having are related to the Board of Nursing inefficiencies, and they reach far beyond one getting their license initially, or in my case, renewed in a reasonable amount of time. It's now negatively impacting access to care. And for me to continue keeping my practice open to the most vulnerable populations, that is, those that are insured with Medicaid and Medicare coverage. The flu season is here, and the state of mental health in our communities is no better, and we will be worse off than when they no longer have a mental health provider. I wanted to close with that because we're here today because we have a deep interest in making sure that people can access health care in the state of Maryland, and making sure that the Board of Nursing has the resources it needs to succeed is a critical responsibility for us because it impacts access to care and quality of care. And that's why I'm so happy to be here today with the Secretary who has agreed to the plan that we have developed together. I think it's going to work. So I'm just going to walk you through it really briefly. I want you all to know the materials you have in your file. We did conduct sort of a mini review. Lindsay Rowe and Tyler Babbage and some others at DLS did a mini review on the Board of Nursing over the interim, identified the problems we all know exist. They need help with infrastructure, operations. They need help filling the jobs that are vacant. They have an incredibly high vacancy rate. One of the challenges that was readily apparent to me that needed to be addressed was the fact that they need help figuring out how to communicate with DBM and procurement and on issues like that. They've testified to us before about that. So in addition to the legislation before you, there's a meeting set up with Secretary Herrera Scott and Secretary Grady next Monday with Karen Evans from the Board of Nursing to try and get started already on helping to address those issues. In addition to the mini review from DLS that you have a bunch of correspondence attached to my packet, but the most important things I really just want to tell you about are the sponsor amendments that are with this bill. So you have a letter of information from the Maryland nurses, and they're asking for a couple of amendments, which I do have as sponsor amendments. One is that they are requesting the part of the bill that says that the executive director be a nurse. That's the current statute. This legislation contemplated removing that, but the Nurses Association would like us to not do that, so we're taking that part out of the bill and putting that into the study, which is in the bill. They also ask for us to clarify that under the new plan, the Secretary would not have authority over policy or regulatory decisions in their letter of information, so we have an amendment clarifying that, there's no intention for the department to have any authority over policy or regulatory decisions. So that amendment is in the packet that you have before you as well. It's the third thing that they're mentioning is that they would like to make sure that there's a significant investment of general funds to support Maryland Board of Nursing's infrastructure, which that issue is addressed in the fiscal note. And again, I cannot thank the Secretary enough for helping us figure this out. So let me tell you what the bill does now that you know that we have those amendments. One other letter of opposition that you have in your file is from Maryland Right to Life. I believe that the amendment that we created for the board of for the Nurses Association that makes clear that this bill doesn't in any way affect policy, it's only about infrastructure, should address the Maryland Right to Life concerns in that letter as well. So that is the intent of that amendment. So basically what the bill is going to do is it's going to take 2 years. It's a 2-year investment from MDH that they are committing to help the Board of Nursing with their infrastructure. So they're going to take over the infrastructural operations and they're going to take over paying for them. That's what it says in your fiscal note. It is going to be tremendously helpful. One of the things you'll see in the addendum to the mini review we did is that they don't have a tremendous amount of reserve in their fund. That's one of the challenges they face with infrastructure. So using general funds to make these operational fixes is going to make a big, big difference. This is a 2-year project. It will sunset after 2 years. So we're extending the Board of Nursing for 2 years. And during those 2 years, the Secretary of Health will have oversight over the infrastructural operations. There is a consultant that will be hired by the Board of Nursing to implement, to develop a plan so that we can get an action plan moving. That would be in coordination with DBM, DO-IT, and MDH. That would be due September 1st, 2023. The legislation also reconstitutes the board. It does allow members to reapply for their positions on the board. For returning members, I will remind you, we have done this before. For new members, I'll let you know for the first time. The language in this legislation comes straight from the bill we did for UMS, which reconstituted their board. We've also done this in the past with the Board of Physicians and the Board of Dental Examiners. It's a strategy that is proven and we found success with on this committee. There is a couple other things in the bill. There's one provision in the bill. You'll see a letter in your file from Kennedy Krieger talking about the importance of having folks be able to stay working while they're trying to take their examination if they've failed at one time. I think we're going to have some testimony to the effect of why that is important. We want to keep people in the workforce and give them the opportunity to succeed under appropriate supervision. And there's also a provision in there that comes from the Commission on Workforce that's going to enable the Board of Nursing to track workforce data more effectively for us. So I think that's everything that's in the bill. I know it's a lot of information, but it's a thoughtful plan, and I want to thank all of the stakeholders who are here who helped us come up with this plan. I'm open to your questions, but what I really want to do is turn it over to Secretary Herrera-Scott. And before I do, I just want to thank her so much for her partnership and cooperation and willingness to take this on. Everyone on this committee, I think, knows what a big deal this is, and your partnership is so much appreciated. I will also tell the committee that I spoke with the governor's office this morning, and they're very supportive. They want to help us help the Board of Nursing succeed so that we can address the customer service issues that impact the quality of care in the state. So they are, someone had asked me a question about the reconstitution of the board provision, if they were prepared to make those appointments, and they absolutely are. So that's it, and I will pass it over to Secretary Herrera-Scott. Thank you.
1 second, just for clarification, there's also a technical amendment for the Maryland Hospital Association, correct?
Thank you. Yes, there's a technical amendment because we miswrote it, but the intention was the same. It's around the examination, the examination provision. We just had a wrong word. Thank you.
Good afternoon, Madam Secretary.
Good afternoon, Chair Peña-Melnick and committee members. I'm Acting Health Secretary Laura Herrera-Scott, and I'm here to respectfully request the committee's favorable consideration for HB 611. I would like to thank Vice Chair Ariana Kelly for her leadership and sponsorship of House Bill 611 and this committee's strong interest in this vital topic. The Maryland Board of Nursing licenses and regulates over 200,000 Marylanders that are the backbone of our state's healthcare delivery system. As such, the Nursing Board makes up about half of the roughly 400,000 total health occupation board licenses in Maryland. The governor has made clear that his administration is invested in strengthening Maryland's workforce. Addressing administrative and infrastructure issues with the Board of Nursing can significantly improve the ability of our nurses to start or continue their careers in the healthcare industry. HB 611 will allow us to work with and support the Board of Nursing in this time of crisis by improving their administrative infrastructure operations, and similar to this committee's interventions with the Board of Physicians to improve their administrative processes over the past decade. Under that arrangement, the Board of Physicians has maintained its autonomy and provides excellent customer service to its licensees as well as the general public. The bill as introduced will allow us to start the immediate and necessary steps to setting the ship right and getting it back on course. With the sunset and reporting provisions, we look forward to continue conversations with this committee on this essential topic. Thank you.
Excellent timing. You can follow, see if you could do that, Nicole.
I know.
Thank you. Thank you, Madam Chair, Madam Vice Chair, and sponsor members of the committee. For the record, Nicole Stallings, Executive Vice President of the Maryland Hospital Association, here today in support of House Bill 611. Let me start by thanking the committee for your attention to this important issue and for the briefing that you had about 2 weeks ago on the topic. At that briefing, we had an opportunity to share a report MHA's task force developed, which outlined a series of recommendations around ways that we can retain and grow our nursing pipeline. Our report estimates that Maryland currently has a shortage of 5,000 registered nurses and of 4,000 LPNs. And without intervention, those shortages could double or even triple in the coming years. And so as we work together over the coming years to grow that pipeline, it is essential that we have a strong foundation. And our 60 hospitals and health systems view the reforms outlined in House Bill 611 as foundational, and this bill is a priority of the Maryland Hospital Association. In that workforce briefing, you heard directly from the board about old technology systems that don't talk to one another, reliance on paper applications, significant staff vacancies, and more, all hindering the ability to carry out core functions in a timely fashion. Simply stated, the board is broken. Waiting weeks and months for a license not only impacts the delivery of care, it threatens the livelihood of those nurses who aren't able to work. The Vice Chair's testimony spoke to those challenges, and in our next panel, we will have chief nursing officers who will also speak to the impacts and illustrate the need for change. I'd like to stress that this legislation is not a reflection of the dedication and commitment of the staff of the board. They are well-intentioned, but they are not well-resourced. MHA has worked closely with the board throughout the pandemic. We heard about their challenges. Our members and our care teams experienced the effects. This bill acknowledges the critical role that the board plays in Maryland's care delivery. We owe it to the board staff, to the board members, to the nurses, and frankly to the patients of this state, to your constituents, to ensure that the board is able to operate optimally. It should serve as an entryway to the workforce, not a barrier. We urge a favorable report. Thank you.
Thank you. Next. And you did it. All right, Dana, come on now.
She was looking at me, though.
Come on.
Thank you very much, Madam Chair. Members of the committee, my name is Dana Kaufman. I'm here on behalf of several organizations that provide post-acute and critical services to our most vulnerable populations. I don't think I could add any more examples than the ones you heard by Vice Chair Kelly. Those are what our member organizations deal with each day as they continue to provide necessary care to these residents. We can't have a robust workforce if we cannot get them licensed. It's not just about licensing the individuals, but it's also about making sure that we have adequate training programs and that we have the registered nurses available to teach those training programs. We must begin to build this pipeline. When we don't have individuals that are able to maintain their work on the floors, then we also have to resort to nurse staffing agencies. And there's two issues there. One, you've heard me say before, they are very expensive at a time where every dollar counts. But also, they're not the best for the patients. They are well intended, but continuity of care to make sure that the same individuals are able to provide that care day in to day out and aren't being taken off the floor because they can't get their license is very frustrating to all. We recognize the challenges of the Board of Nursing. We definitely want to work with them to make these changes. We appreciate these changes, and we think that this bill will provide all the necessary tools and resources so we can keep building our workforce, because the workforce we have now is insufficient to meet the demands that are coming in later years. So thank you very much.
Excellent. Excellent timing. So we're going to open it up now for questions from the committee. Are there any questions for this panel? Delegate Rosenberg.
Thank you, Madam Chair. You talked about a significant need to hire staff for the board. Do you have a sense of how long that would take and whether any change in the law might be needed to expedite that?
So as far as the hiring process was within the state, so I don't think any changes in the law are needed. I think there are maybe extra steps in the process that need to be evaluated that are slowing down the work, and then enough staff to interview and screen. So I think by having additional resources from the department to help do that, we can onboard people into the positions that need to be filled faster.
But you said, are these extra steps mandated by law?
Not that I'm aware of, but I won't know until we get in there to understand what their process is.
Thank you. Delegate Kelly, I believe, highlighted the need for about not, sorry, I might need a nurse. No. So about 9,000 nurses and nurse practitioners, I believe. And so how many do you think you could fast track through this versus like the regular track?
Let me try to my mic, if this mic will turn on, maybe. So I think we do have the Healthcare Workforce Commission that is looking at data. Right now, one of the things in this bill is it's going to statutorily allow the Board of Nursing to do a better job of tracking that workforce data that we need. So that legislative change was recommended by the Workforce Commission. I know there's one question, one answer. I suspect the Hospital Association has a little bit more information about the pipeline challenges we're facing, but right now, we have nurses that are licensed who can't even get their licenses renewed in a timely manner, as well as nursing graduates who aren't able to get their licenses issued. So I think that's the sort of low-hanging fruit that we need to solve for immediately, which is why this is urgent. I will add, when I described the bill, I didn't mention that this is an emergency bill for that reason.
Kaiser.
Thank you, Madam Chair, and thank you, Madam Vice Chair. Just a simple question. I'm sure you called the Board of Nursing at different times over the years. What were the kind of answers that you received?
Thank you for your question, because I really want to take an opportunity again. I know we're going to hear testimony from the Board of Nursing after the proponents on this. These are people of goodwill who are working really, really hard. Their challenge is infrastructure, right? And this predates COVID. This has been going on for decades, I would say, in the Board of Nursing. They have a high vacancy rate. So a lot of the staff are spread very, very thin. And so I think, they have been very, very good at working to respond to urgent situations. You saw in my list of concerns that were raised, a lot of it involved us, and I've heard this from the stakeholders involved as well, not just legislators, but employers, calling personally to the executive director and her deputy and saying, this particular person's license needs to be expedited or else bad things will happen in the healthcare system. If you spend all of your time putting out fires and living in emergencies, you can't do planning, you can't do hiring, you can't do anything else. The point of this plan is to give them the relief that they need from the emergencies, right? It's on fire. I think I said that before at the briefing. This is going to be a huge influx of resources, as well as elevating those conversations with DBM to the secretary to secretary level to make sure that we can see the change we need immediately. Does that help?
Thank you. Any other questions? Seeing none, I want to ask each of you the following question, and I'm going to start with Delegate Kelly. What happens if we don't pass this bill?
Wow. I don't like to imagine a world where we don't pass this bill, because I think it is so important. If we don't pass this bill, we will continue to have issues with the licensure, with the renewals, with the approval of educational programs. We're going to see an increased shortage of nurses who are available in our workforce. We're going to have constituents in our communities who are trained and willing and want to work to provide care who aren't able to work, and we're going to have patients who aren't getting the care that they need. It's going to get worse, not better, if we don't pass this bill.
Ms. Kaufman.
I would say that we're at that critical juncture where the scale is going to tip, and we're not going to be able to meet our mandated staffing requirements, and we're not going to have enough people on the floors to be able to meet the demands of our patients. And I don't think anyone wants to see that happen. We all have the same goal as being able to provide quality care. Thank you.
And Secretary Laura Herrera, isn't it true that if you don't pass this bill, all laws regulating nurses terminate July 1st?
Based on the sunset provision, yes, yes. And just to add and piggyback, not only what was said already, it means potentially closures of beds and creating additional waiting lists, some of which we know in certain areas, so the emergency room is an example. Also people leaving the state and going to West Virginia, Pennsylvania, other states to work because they can't get their licenses here.
Nicole?
I'm on a panel with some very smart women. I agree with all of them.
Thank you. Well, I want to take a minute to thank you, Delegate Kelly. This has been many months of work trying to meet with everyone and compromise. And I want to thank the Secretary for your willingness to do this, do the administration for 2 years. It's only for 2 years. And paying for it, which is going to cost $10 million. Yes, so we thank you. Well, you're doing great. So I want to thank you for doing that and being willing to, meet us halfway. And thank you so much for your testimony today. We really appreciate you. Next, we have the following panel, and I'm going to call you together because it's favorable. In the interest of moving us along, we have actually Crystal Beckford, Stacy Garnett, Allison Cyborowski, Laura Jessic, and Lisa Jordan. If you can bring up some chairs, that would be great. And please let us know your name, and you can get started. And thank you for being with us today. Who would like to start? Okay.
That's okay, Madam Chair.
Absolutely. Thank you.
Thank you, Madam Chair and Madam Vice Chair Kelly and members of the committee. My name is Allison Cyborowski, and I'm here today on behalf of Leading Age Maryland, and we request a favorable report of House Bill 611. Leading Age Maryland is a community of more than 140 different organizations that are nonprofits who provide healthcare, housing, and services to more than 20,000 older persons each year. I think the panel before us demonstrated and clearly communicated the need and the crisis that we're facing. I want to spend my time today just sharing a few more examples of feedback that I've received from members over the past 2 to 3 days related to their challenges in working with the Maryland Board of Nursing. It really breaks down to a few key areas: recurring issues with communication. Applicants fail to receive timely responses to phone calls, emails, questions, and concerns. It's common for phone calls to not be answered, emails to not be answered. I even spoke with one director of nursing who waited on the phone 5 to 6 hours, 2 different times in the course of a few weeks. When calls are answered, applicants are not always provided with correct information, leading to further delays. Another challenge is lack of procedural consistency. So my members report that some Board of Nursing staff members reported to accept documents in a certain form that other staff members wouldn't, causing confusion. Applicants report being told different procedural steps from different staff members. For example, one individual I spoke with was directed to come in person, and when they got in person, they were told to go home and apply online. So just lots of challenges and back and forth. And then lastly, exorbitant delays in processing new licenses and certifications and renewals, which you've already heard about today. But this is really causing challenges with having enough staff in our workforce to provide services and supports to the older Marylanders and others who need care. So these issues and many others are negatively impacting the readiness and availability of qualified nursing professionals in Maryland. If enacted, we believe that this bill would be beneficial in ensuring that the Maryland Board of Nursing has the resources and support to operate more effectively and efficiently in the future. Thank you.
Thank you. Who will be next?
I can go next. Good afternoon. My name is Stacy Garnett. I'm Vice President and Chief Nursing Officer at Shepherd Pratt. I've been a nurse for 34 years and in the treatment of mental illness for 19 years. Madam Chair, Madam Vice Chair, and members of the House Health and Government Operations Committee, thank you for the opportunity to participate on this panel today. I would like to welcome the new members of the committee and look forward to working with each of you. Shepherd Pratt is the nation's largest private nonprofit provider of mental illness, substance use, special education, developmental disability, and social services, consistently ranking within the top 10 of psychiatric providers in the United States. With more than 400 licensed inpatient beds, 160 programs, and 380 sites of care across Maryland, Shepherd Pratt cares for every Marylander and is the only hospital that receives patients from the emergency department of every other hospital in the state. Between physical locations in 16 Maryland jurisdictions and throughout telehealth, Shepherd Pratt serves Marylanders in every corner of the state. Being able to staff our programs adequately and clinically appropriate is key to our ability to effectively serve patients. Access to care the lack of access to care directly impacts us. I once worked with the colleagues that says access is the tide that floats all boats. Having appropriate flow of patients is critical to success. We want the Board of Nursing to have resources to help them do better. We'd like to thank Karen Evans, the Executive Director, for really trying really hard for Shepherd Pratt. Respectfully request a favorable vote of House Bill 611.
Thank you. Next.
Good afternoon. My name is Crystal Beckford. I want to start by thanking our Madam Chairman and Vice Chair for the honor and privilege to be able to speak on behalf of Bill 611. My name is Crystal Beckford. I am the Vice President of Patient Care and Chief Nursing Officer at Luminous Health Doctors Community Medical Center. We have 2 general acute care hospitals, including Doctors Community Medical Center as well as Anne Arundel Medical Center. And we are pleased to express our strong support for House Bill 611. That includes the State Board of Nursing sunset extension, licensure exceptions, board operations, and membership. The House bill will provide the greatly needed solutions to reduce the barriers to obtain licensure through the Maryland Board of Nursing. Senator Delegate Kelly captured, I think, what many have experienced, particularly in the healthcare setting and in our systems. So I'm not going to belabor that with our experiences, but now I want to share now more than ever before the pandemic has demonstrated this, that Maryland's nurses, nursing assistants, midwives, patient care technicians, and electrolytists, they personify the selfless professionalism and steadfast commitment to furthering the health and wellness of patients throughout the Maryland. And the challenges that the Board of Licensing faces on a nearly daily basis are very real. It is extremely important as a nurse of 30 years and an executive nurse of the last 8 years of my career that we fund the Board of Nursing and ensure its efficiency, quality, and accountability. So people in my row, and more importantly, the community, because each and every one of us is impacted by this, has qualified nurses and nursing assistants that we can get to the bedside faster. I do think it's important that as we make this move and as we support this bill, that keeping the nursing board independent so they can administer the nurse-sensitive investigations and disciplines is extremely important and it's extremely complex, and the infrastructure needs to be supported. In addition, the funding needs to be there. Thank you.
Next, please.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. I'm Laura Jessic, the Sexual Assault Kit Initiative and Sexual Assault Response Team Manager with the Maryland Coalition Against Sexual Assault, or MCASA. I'm here at the invitation of our director, Lisa Jordan. MCASA is a nonprofit membership organization that includes the state's 17 rape crisis centers, law enforcement, mental health, healthcare providers, attorneys, survivors of sexual violence, and other concerned individuals. We are here in support of House Bill 611. Sexual assault survivors have the right to a free sexual assault medical forensic examination provided by a certified healthcare provider known in Maryland as forensic nurse examiners, or FNEs. During this exam, evidence of the crime is collected, medical care and treatment is provided, and critical medications like HIV and pregnancy prevention are prescribed. However, the ability to obtain such an exam is dependent on the availability of an FNE. The Board of Nursing, which is responsible for issuing FNE certifications, currently lacks adequate technology and staffing and is consequently unable to efficiently process applications and issue FNE certifications in a timely manner. The consequence of this lacking infrastructure is severe. For example, one jurisdiction had an FNE qualified to provide exams to children under the age of 13 for 3 months. But due to processing delays, she was unable to practice, which meant children experiencing sexual assault in that jurisdiction weren't able to obtain care at their local hospital. Imagine being a parent seeking care for your young child after learning they have been sexually abused, only to report to the local hospital and be turned away. Now imagine that a qualified nurse was available to assist, was available but unable to assist simply because their certification hadn't been issued yet. Sexual assault and rape are traumatic events that no one should have to experience. And when it does happen, survivors should have easy access to care. Every time a survivor is turned away due to a lack of FNEs, it is re-traumatizing, devastating, and a barrier that could jeopardize the survivor's health, well-being, and the viability of the forensic evidence. Please help ensure that no survivor is turned away when they seek a forensic medical examination and report favorably on House Bill 611.
Thank you for everything you do and for your testimony today. I'm going to open it up for questions now. Are there any questions from the committee? Delegate Rosenberg, will you be so kind and remember to put the light on? Thank you.
Is it fair to say that the regulations and statutes that affect nursing and impose certain requirements on the provision of care will remain law, whether or not which makes it that more urgent that we have a Board of Nursing authorized after the sunset period so that the laws can be carried out. Is that a fair assessment? Whoever.
One person.
Yeah.
If anyone feels it, if you cannot answer it, it's fine, but can you answer the question?
I would say I'm not adequately able to answer that question from the sexual assault perspective. I'd turn it over to one of the nurses in the field.
Yeah, and I think what I heard would the laws remain the same. And I would say, I would answer the laws would remain the same under the circumstances. The laws would not change with that timeline coming to an end.
Having a board, which makes the case for having a board remain in existence with the changes proposed in the bill or with any other changes. I mean, we need a board.
We need a board. We need a board. We need an independent board that can operate and has the infrastructure and the funding.
And if just for clarification, the board is due to sunset, correct?
Yes.
Yes, okay, thank you. I have Delegate Collison, followed by Delegate Johnson.
Thank you, Madam Chair, and thank you all for being here. And what was striking me during your presentations, we heard from the Hospital Association in the first panel, and what struck me about this presentation was the issues that have been raised around what the capacity of the current board affect virtually every aspect of healthcare in our state. So I'm going to do something silly and say, isn't that so, Allison?
Yes. I think that is a very astute observation, Delegate. Yes, it absolutely affects, as you're hearing from the acute care side, post-acute, home care, hospice, as we heard before, what was it, 200,000 Marylanders who are licensed or certified by the Maryland Board of Nursing. It's the backbone of our healthcare and support system. So we need them to be fully supported and able to handle all of the individuals that come their way.
You didn't know that this committee has a sense of humor. Delegate Johnson.
Thank you, Madam Chair. This question is for the nurse of 34 years and 19 years of mental health experience. What do you see happening if we do not pass this bill in the mental health field?
I see patients staying longer in EDs and not getting access to the direct mental illness treatment that they deserve, even more so than they are today.
My pleasure. Any other questions from the committee? Seeing none, I want to thank you on behalf of the committee for coming today, and we do value your time. Thank you so much. Next, we have two unfavorable panelists, and the first one is Ms. Karen Evans with the Maryland Board of Nursing, and then we have the Maryland Board of Nursing, Ms. Heather Westerfield. Will you be so kind and come up? And good afternoon. How are you?
Good, thank you.
Good. How are you? Good. Nice to see you. You can get started. Whoever would like to go first. And thank you for your time today.
Okay. Thank you, Chair Penna-Melnick.
My pleasure.
Okay. Madam Chair, Madam Vice Chair, members of the Health and Government Operations, thank you for this opportunity to testify. In regards to House Bill 611, my name is Karen Evans, and I'm the Executive Director for the Maryland Board of Nursing. The Board President and I are scheduled to meet with Secretary Herrera-Scott tomorrow with the aim to renew the Board's partnership with the Department and move towards cooperative and productive relationship. With the new Secretary and incoming administration, it's already more positive and oriented towards solving the resources issue plaguing the Board at this time. The Board does have a couple of requests. The first is for the Secretary in consultation with the Board as far as hiring the Executive Director, if the Secretary would just consult with the Board. Not only with that, but also for board members when the seats become available. The reason for this is because of the specialties and diversities that are needed at the board, especially when it comes to board members. For instance, if we have all acute care board members, that doesn't serve well if we have a long-term care person coming for a hearing, let's just say. So just to make it fair, if we need a pediatric or whatever the case may be, just making sure that it's fair to that extent. The other request the board has, and I'll just speak on this briefly, is to change the time frame to remove all of the board members instead of 3 months apart, if we can space it 6. This is because,
It's okay. You know what? Go ahead and do your testimony, okay?
Okay, thank you.
My pleasure.
Chair Payne-Melnick, I
Go ahead.
appreciate it.
Go ahead.
I promise I won't take long.
It's okay. You go ahead and do it.
The reason for this is right now we're in a serious crisis with nursing programs throughout the country and imposters and fraudulent nurses. And to remove all the board members within a 6-month period of time will really threaten our cases as far as hearing and getting those imposters off the street. It is a national emergency. All of the state boards of nursing are working together. And just so you know, part of the reason why this has happened is because this board tipped off the FBI in this situation. And so we have been working diligently with them for the past 4 years. In fact, they have other boards come to this board for help with this. So we have been working strongly on that. We've had committees. And so for us, I just don't want everyone to move at one time. It's really serious. These nurses should not be taking care of anyone. In fact, all they did was pay for a diploma. That's it. They paid for a diploma. No nursing education, no nothing. And so that's a very critical concern for public safety at this time. And so I just want to thank you for allowing me to speak and testify on House Bill 611. I urge the committee members to address the board's concerns in this matter. identified in my testimony as well as what is written. So thank you all again for allowing me to testify.
Thank you for your testimony. And look, I know it's been hard with COVID and everything. It's a tough job for you to do. And I really want you to know that the committee is really just thinking about your best interest and the best interest of every Marylander, and that the secretary being at the table and trying to find a solution is to help you do, a great job and to help people stay in their jobs, because we have a serious workforce shortage. So it's not personal at all. So I thank you for being at the table. I know this is hard, okay? And we are at the table with you. Good afternoon, ma'am. Will you get started?
Yes, thank you. Good afternoon, Madam Chair, Madam Vice Chair, and members of the Health and Government Operations Committee. Thank you for the opportunity to testify in opposition to House Bill 611. My name is Heather Westerfield. I am currently serving as an RN member, associate's degree educator, board member for the Maryland Board of Nursing. I have proudly served in this position for the board over a little over a year. As a member of the Board of Nursing, I have seen firsthand the tremendous amount of work that is being done with an extremely limited amount of resources. While I'm concerned with multiple aspects of this bill, there was a letter of concern written from the Board of Nursing that addresses them. I want to speak to 2 points I feel very strongly about. One has been addressed, and that is to repeal the registered nurse requirement for the executive director of the Board of Nursing. So thank you for that amendment. Secondly, House Bill 611 proposes to terminate the terms of the members of the board. This is extremely concerning, as it takes about 1 to 2 years for a board member to fully understand the board processes, regulations, and other responsibilities, such as the Probation and Reinstatement Review Committee or the Safe Practice Committee. Removing the board members within a 7-month time frame will severely disrupt investigations, evidentiary hearings, and could violate the due process rights of our respondents. While what works for other boards, we heard this has been successful, that will not work for the Maryland Board of Nursing. We are one of the largest boards in the state. I've heard we need a board. The board is the backbone. So I encourage you to keep the board as it is, or take the time, as Ms. Evans has asked and requested, that it takes time and not done so quickly. In closing, I ask you oppose 611 and consider how terminating the terms of the current board members would negatively affect the Maryland public. Instead, let's identify how the Secretary and the Maryland Department of Health can work together with the Board of Nursing to implement solutions that would benefit not only the state of Maryland, but our nursing constituents and patient population. Thank you again for allowing me to testify in opposition to House Bill 611. I urge the committee to submit an unfavorable report.
Thank you for your testimony. We really appreciate it, and we appreciate your service. A year, you're giving this out of your own personal time, so we appreciate it. There are some questions, though, from the committee. I saw Delegate Johnson first, and then Delegate Alston. Delegate Johnson.
Thank you, Madam Chair. This question is for Ms. Evans. You spoke about some fraudulent nurse cases. What does the backlog look like right now? How many cases are we talking about that are ongoing right now?
So ongoing right now, I have to be careful of what I state because it is still ongoing with the FBI. So there's things I can and cannot state because of that. It's not a backlog with those cases because this is a priority for us. And so we have been working diligently. Actually, we've been working diligently for 4 years. So there's a lot of individuals we have removed as far as their license is concerned, or they have surrendered their license. So it's not a particular backlog in that case. We are, and I'm sorry, it's just I'm trying to stay within my frame for the FBI. It's ongoing. So what I mean by that, we received, outside of the ones that we have identified, the FBI has also identified. So we're looking at that case, those cases. And we're working with other boards because of how how someone can endorse into another state. So a particular number I can't give you because it's still ongoing, and that number is going to change at this time.
My pleasure. Delegate
I'm sorry I
Alston.
couldn't give you more.
Thank you. Delegate Alston, followed by Delegate Riley.
Thank you, Madam Chair. My question is, if we don't do this, what is your suggestion on how to fix the problems that you all have been facing? In particular, you mentioned the investigations as well as potential due process rights violations. And I'm thinking that there have been a significant number of those already with the fact that you can't process the work. So if we don't do this legislation, what is your proposal to fix the problems?
Only one person can answer. Who will be the best person for this?
I guess that's me.
Okay.
What I can say is what should have happened a long time ago with the previous administration is that they should have allowed me to procure the IT system that was requested back in 2018. And I had also asked to meet with DBM and HR and the Board of Nursing so that we could work on this together, as this bill suggests, to work on this, and it was always turned down. And so, and this is not a new situation. This is long before I arrived at the board, since 2010. That's when the first sunset review had taken place. So I don't, for me, it would be, can you just provide us with the resources that we needed? When it would have been different. We would have been in the cloud instead of still working with servers for our IT. Our IT systems are over 23 years old, and so that can't match what we're doing. So as I stated, I've already reached out to the secretary. She has graciously set up a meeting with the board president and myself. So I'm really maintaining positivity because that's what I see right now. So I wish I could give you a better answer, but.
We have Delegate Riley, followed by Delegate Shalega. Delegate Riley.
Thank you, Madam Chair.
My pleasure.
Actually, Delegate Johnson pretty much asked the question I was going to ask, but I'll just piggyback on that question. I know you can't say a lot because it's still under investigation, but the nurses that you were talking about that were fraudulent, were they able to get into our system and actually actively working and then found out to be fraudulent, or did we catch them ahead of time at the processing stage?
I can answer that one. It's two-pronged. I arrived September of 2017. I noted this early of 2018. So prior to that coming aboard, the answer to your question is yes, there are some that were licensed and working. After that, I instituted substantially equivalent schools, which has stopped a lot. So if you look on our website, we have at least 16 schools, and now we're going to add the 3 from Florida on that list of do not hire. And what they've done is now they said do not go to Maryland because Maryland won't license you. The gig is up for us, yes.
My pleasure. Delegate Shalega.
Thank you, Madam Chair. Thanks for being here. So this bill allows current board members to reapply. Would that work? Won't that work if the board members can go ahead and reapply?
So, of course, that would work if a certain number of board members were permitted to come back. I urge everybody to consider if you took an entire nursing unit, we're talking about nursing, so if you took the entire nursing unit and said, you're all fired, but you can all reapply, and only some came back, how would that unit run? How would any business run if everybody is wiped out within a short period of time? Like Ms. Evans stated, there are a lot of different hearings. There's a lot of individuals that have history that can help move things along. You would never want to just wipe out in a 7-month time period the entire board. So that could really affect Marylanders.
Well, hopefully some will reapply. Thank you.
Let's hope.
Are there any other questions?
sorry.
Vice Chair Kelly.
Sorry, just a technical clarification. Thank you both for being here. I really, really appreciate it. Because it's not in your written letter, Ms. Evans, and thank you for everything you do all the time. You and I have worked together very well, and you have helped me solve so many problems, and I'm so appreciative. You're asking to change the spacing in the board process to 6 months apart from 3 months apart. So I'm looking at the language in the bill. And so right now you have 5 board members leave, and then 3 months later, another 5 board members, and then 3 months later, another 4 board members, which is a totally different time. When we did this with the Board of Physicians, everyone went all at once. The next day, they were replaced. So this is a phase out, and it does, to Delegate Schlegel's point, allow for people to reapply. So I guess I'm looking for, I'm trying to meet you where you're at and trying to, help you. So are you suggesting that you would rather it would be, say, July 1st and then 6 months later, so skip the October 1st and go to January 1st and then skip to whatever the next is, July 1st? Is that your suggestion?
Testified is that the history in these cases, we want to get them sued. We want to get the individuals off and not in the public to hurt patients. It's a lot for a board member. On average, it takes a good 2 years for them to truly understand the role. So this way, if we phase it out, we'll have some of the older board members there to help train the new board members for the whole process. In the past, and it's been, there is a new board member orientation that usually happens once a year. And so I don't know where that's going to happen this year, but this current fiscal year. But they gain, it's really excellent orientation, and they gain so much knowledge with that then when they come to the board, they're able to apply the knowledge that they have. But since it's once a year, we don't know what happened. But my biggest concern is having due process for the constituents, to make sure that even those for other cases, because this is not the only hearings that we have, are afforded the due process as well, and just having that knowledge.
So would it be helpful if we, instead of having 3 transition periods, we just had 2 transition periods 6 months apart, and then you could tailor your orientation twice a year maybe? Would that be helpful, that if we did maybe July 1st and January 1st and did half the board at each time?
That's better. That's better.
Thank you very much.
You're welcome.
Any other question for this panel? I would like to ask you a question, Ms. Evans. So your testimony states unfavorable, but it's really not unfavorable, correct? Like you're willing to work with the department, right? Okay.
Wasn't afforded to me before, so I have reached out to Secretary Scott myself to just welcome her, but to see if we could just sit down and have a conversation about the board so that she has a true understanding of what is going on and what the needs of the board are.
Thank you. And to the board member, you have asked us to vote against the bill. I'm going to ask you a question. Do you really think that things can stay the way they are?
Oh, absolutely not. I just don't know that we need to go to these measures to get to where we need to be. The board has been asking for help for years. The board has had consultants come in and demonstrate the need that's there. And so that's not new. It was just the way in which it was presented, that with no nurse as the executive director and removing the entire board, among a few other things in there, I don't know why that has to be done rather than the secretary working with the Maryland Board of Nursing to ensure those things occur.
Right, but the truth is that if we don't do anything, something has to be done, correct, to improve?
Absolutely. There's
All right.
no doubt about that.
Yes, thank you. This will conclude the testimony for House Bill 611, and I thank you for your work. We hear you. I thank you for being willing to sit with the secretary, and I look forward to having, a working, long-lasting relationship with a board that functions. All right? Thank you so much for your time and your efforts. I want to thank the committee for your questions, respectful questions, and for your patience. Next, we're going to go to House Bill 19. And after House Bill 19, we are going to have a briefing from DLS. And House Bill 19 is Delegate Collison. Yes?
Primary sponsor to be Delegate Woods. So if I may, cede my time to Delegate Woods, please.
Absolutely. Delegate Woods, good afternoon. And House Bill 19 for our committee, it is actually State Board of Examiners of Psychologists, license and registration issuance and renewals, electronic means. Delegate Woods, welcome to the committee. It is your first testimony, and we look forward to it, and you can get started.
Thank you. Good afternoon, Madam Chair, Vice Chair, and members of the Health and Government Operations Committee. I am Delegate Jamila Woods. I am here in support of HB 19. In alignment with efforts to make psychologists who meet established licensing requirements more readily available for service to their stakeholders, this legislation seeks to repeal current requirements established by the State Board of Examiners of Psychologists for licensing requirements to be mailed via first-class mail. This bill also reverses current licensing procedures, repeatedly requiring certain previously verified information to be included on each license and registration. Technological advancement has afforded the opportunity for swifter, less complicated, and more precise recording of required information across the board for professional service providers. Electronic filing provides for the immediate transfer of required information from one source to the other, allowing for the immediate compilation of information within the State Board of Examiners, and it eliminates the need to transfer paper copies, the assembly of materials from multiple sources, and the labor-intensive process of assuring all information is included. The adoption of this legislation will afford the state of Maryland an opportunity to join other states whose psychologists currently benefit from credential renewal through electronic filing, including New Mexico, Wisconsin, and Idaho. Finally, electronic filing is cost-effective. It results in the elimination of postage, except in those instances where there are barriers to effective communication between the licensee and the licensing agent electronically. In those instances where the board is unable to reach participants electronically, they'll be required to send renewal notices by first-class mail to registrants or at the specific request of the registrants. We've all witnessed the sometimes challenging processes involved in what the results of ongoing technological advancement now refers to as snail mail. This can be due to various circumstances, nevertheless potentially adversely impacting the timely delivery of information to recipients and resulting in those unintended consequences. Electronic filing will alleviate this and other timely reporting barriers. I should also note there is no fiscal effect, as the change is procedural and does not affect government finances. I am requesting a favorable response to HB 19. Thank you.
Excellent. Who is next? Try to follow that. Who's next? Yes.
That'd be me.
Yes.
Hi, good afternoon, Madam Chair and Vice Chair and members of the committee. So nice to see you all again in person. My name is Lorraine Smith, and I'm the Executive Director of the Maryland Board of Psychologists, and I'm here in support of this bill, of course. And as Delegate Wood stated so nicely and clearly, I concur with everything that she said. But I'll just say a little more since I'm here in person and I have you. This bill actually, just as she stated, it permits those holding an active license or registration to print verification of their status from the board's website, instead of the board having to mail a license out. In addition, this bill allows the board to email renewal notices instead of mailing them out as well. Several boards have already moved to a paperless platform. These changes will reduce the time it takes to receive a license and expedite communications between the board and licensees. The board respectfully asks that you support this bill. Thank you for your time and consideration.
Thank you for the time. Look at that. Thank you. How about you? Will you follow that, please?
I'll try.
Okay.
Good afternoon, Madam Chairwoman and Vice Chair. My name is Mark Trollinger, and I am here on behalf of the Maryland Psychological Association. And I would like to state that we support this bill and request a favorable report. And I just want to tell a little bit of what it's like from our end when things get delayed, when we're trying to do a renewal or trying to do things, you know, having to send things through the mail, or if they're received through the mail, it involves this giant waiting period where you're like, is it getting there? Do we know if it's getting there? And it's not anyone's fault from either end, because there's no way to know exactly when it's going to arrive. So it's, you know, repeatedly going, okay, do I call again? I don't want to be bothering people, but, you know, it's been 2 days. I wonder if it's come in yet. It should be coming in, or something should be on its way. Like, it just creates all this angst that really isn't necessary and actually slows the process down. So I just wanted to take a few moments to let you all know that I really believe, and personally, as well as the Maryland Psychological Association, that this will help speed things up and improve processes. Thank you very much for your time.
Thank you. This is the time where we ask questions, and my question will be, are there any questions for Delegate Jamila Woods?
Wow.
Is your heart going really fast?
Wow.
Okay, seriously, are there any questions? We have Delegate Hill.
Delegate Woods, actually, you may want to pass off. I noticed that you do have in here for the renewal notices an option that the person can request it.
Correct.
Come by snail mail, or if the electronic is rejected, that it will be sent out. What I don't see is anything that says for the license itself, if the person requests that it be sent to them. Because believe it or not everyone has the ability to print things out. Why are we not giving people the right to say, I can't get it this way, can you just mail it to me?
Sure, I can answer that. Actually, we will not have that, we would not have that set up anymore. I mean, it's a whole nother process, meaning you actually have to order licenses and complete them, and you need a different kind of printer. So it's a whole nother operation to actually print a license. Yeah, I mean, they can actually, I mean, we can print what they see from the website and we can mail it. We can certainly do that, but it would no longer be the old license.
So they could ask for it to be printed.
Sure, we could print it from the website. No, not at all. As long as they understand that it won't be the old license. That's right, it won't be on cardboard. Right.
Thank you. Delegate Taveras.
Sorry. Yes, thank you. Hold on. My question is, what happens if there's a mistake in the email? Is there a mechanism to correct, or, I mean, in cases where the email does not bounce?
The email does not, I'm sorry, I missed that last part.
Bounce back.
Bounce back? Well, I'm sure that the licensee is going to contact us at some point, but that's no different than through the mail. If the mail goes out, if we actually mail it and they don't receive it, we have no way of knowing if it doesn't come back to us unless they contact us. So that would not be any different.
Thank you. Thank you.
Sure.
I see no other questions. Actually, yes, Delegate Riley.
Right, it was kind of late,
It's
my
okay.
apology. So when this is sent out electronically, I'm sure there's going to be some type of stamp or some kind of marking on it, even though it's sent electronically, to show that it's an official document, correct?
Well, it's available now, so it's not new. I mean, you can verify your license online currently. And it's coming from our website only. It's only pulled from us, from the board's website.
So there's some way that they know this coming from the official website?
Yes.
It, so this is the official, because we know there's a lot of hackers out there today and sending all kinds of, fake things and documents around. But there's going to be something on there that they can only receive it through that website, and it will be official. Okay,
That's
thank
correct.
you very
It's
much.
pulling directly from our database.
Thank you.
Thank you, committee, for your excellent questions. Actually, this will conclude. There are no other questions. You did a great job. Conclude the testimony on House Bill 19. Delegate Collison, thank you, and Delegate Woods, great leadership. We're going to do one more bill, and then after that bill, we will go into the briefing, and then we have one last bill, okay? So let's see if we can get through this bill, because the briefing is supposed to start at 3:30, and it's 3:15. We're going to call now House Bill 26, Delegate Bagnall, Health Occupation Psychologist Licensure Qualification. Will you come up with your panel, please?
Hello. How are you?
Good afternoon.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. For the record, I'm Delegate Heather Bagnall, District 33C, Anne Arundel County, here on behalf of House Bill 26, Health Occupation Psychologist Licensure Qualification. You have my written testimony, so I will quickly summarize. Last year, our office became aware of a difficulty for some postdoctoral psychologists wishing to move from non-clinical to clinical settings to respecialize as clinical psychologists. HB 26 creates an additional avenue for postdoctoral psychologists who hold doctorates in a non-clinical psychology field to respecialize through appropriate programs and training to enable psychologists to meet the educational requirements for licensure. This is specifically for postdoctoral psychologists who hold doctorates in a non-clinical psychology field to provide for a pathway to clinical licensure without requiring the completion of a secondary doctorate. This pathway for meeting education requirements for clinical licensure for doctoral psychologists is already standard in Maryland's surrounding states, as well as within the federal government, within the VA, and the military. 40 states have open criteria allowing requirements to be met without a full respecialization. And with the great need for behavioral health services, HB 26 is an important workforce development bill for the behavioral health workforce. The bill before you represents hours of work and consensus with our stakeholders, including the Board of Examiners of Psychologists, who worked in good faith with our office last year to ensure the high standards of the profession are maintained and is in the same posture as it passed the House unanimously. There was no opposition in the Senate. We simply ran out of time. We have a significant deficit of licensed clinical psychologists to address our behavioral health needs statewide, and House Bill 26 provides an essential tool to licensure for doctors who want to provide for patients. House Bill 26 has no opposition, and for all these reasons, I would respectfully request a favorable report on House Bill 26.
And thank you for working your bill. Who's next?
Hello again. I want to thank you again for allowing me to be here. Again, Madam Chairwoman and Vice Chair, thank you very much. Again, my name is Mark Trollinger. I'm here to voice my support for this bill. So I want to give a little bit of an understanding. I went over a lot of information in the written part of it, but I want to make some things clear. What happens is somebody who has a doctorate that is not in one of the three clinical pathways of clinical, school, or counseling psychology, has another form of psychology, let's say industrial organizational psychology, would then go back to a school, and in this case be trained in the same program that is APA accredited that the clinical students are going through. They would take the exact same courses, sit in the exact same room with them, with the exact same professor. They would meet the same requirements for practicums. They would meet the same requirements for applying for internship through the match process. So they literally would go through everything in the exact same process short of doing a second dissertation. This is a pathway that's been supported by the American Psychological Association since, I believe it was 1977, and they reiterated that position in 2019 when, given the national things that happened, it made it more difficult for people to have an alternative route to licensure, including the respecialization. They reiterated their point that a respecialization is the pathway that they view as being equivalent and being a way to justify that somebody has done the appropriate training, and they actually state that, in their viewpoint, it's a value to have somebody that's been in another form of psychology as well, bringing in all of their knowledge and everything from that specialization to be able to then also have those pieces of knowledge and resources making them at least as qualified, if not more so. And that's coming from them. So I think that's pretty high standard. I want to say I hope that you will report favorably on this bill, and thank you very much for your time.
Thank you for your time today. Next.
Madam Chair, members of the committee, Dan Martin with the Mental Health Association of Maryland here in support of House Bill 26. We have a terrible mental health workforce crisis in the state, which we'll be hearing about throughout session. But, just real briefly, 11 entire counties have been federally designated as mental health professional shortage areas. 17 of 24 jurisdictions in the state are below the national average in mental health providers to population. And, as demand continues to increase for mental health services, we need to make sure that individuals that are qualified, willing, and able to deliver care, that our law doesn't preclude them from doing so. And so, this is just a modest expansion. Again, it allows respecialization from somebody that already has a doctorate in psychology but not in clinical psychology to, provide, to respecialize, to provide that clinical care. And, we worked really, really hard last session with all the parties to get to a point where there was consensus on this bill. Like Delegate Bagnall said, it passed unanimously out of here. It passed unanimously out of the House. It would have passed in the Senate, but we ran out of time. And so it's been introduced in the same posture as that consensus piece of legislation, and would urge your favorable report.
Sure.
Good afternoon again. It's Lorraine Smith, still with the Board of Psychologists. Thank you for your time. As it was stated, this bill expands the definition of a degree in psychology to include a psychology degree from a regionally accredited program when an individual receives a respecialization certificate in a health service psychology field, such as clinical or counseling. The board supports the expansion of qualified psychologists, and to ensure that the current high standards of psychologists are not lessened, the board recommends that the respecialization program includes an internship. Accredited internships provide high-quality training and clinical practice. The board respectfully asks that you amend the bill to include an internship. Thank you for your time and consideration.
Thank you. We have a virtual witness, and that is actually Pat Savage with the Maryland Psychological Association. Good afternoon, sir. Will you be so kind and unmute yourself and give us your testimony? You can start by introducing yourself to the committee. Good afternoon, sir. Can you get started?
The Honorable Chair Penemelnik, Vice Chair Kelly, and members of the HGO Committee.
We can hear you. You can continue, sir. We hear you very clearly.
You hear me now?
Yes,
Okay.
we can.
Good. Good afternoon. It's good to see you and many friendly faces again this year. I think this is the third year in a row that I've had the opportunity to speak with you about issues affecting the mental health of Marylanders. Thank you for the opportunity to address you again today on House Bill 26. I am Dr. Pat Savage, a licensed psychologist who lives and works in Maryland. I come before you today as chair of the Maryland Psychological Association's Legislative Committee, testifying in strong support for HB 26. I represent over 1,000 doctoral level psychologists living and working throughout Maryland. As you've heard, HB 26 is designed to increase access to mental health care while maintaining the quality of care in Maryland at a time of unprecedented demand for mental health services. I want to thank you for last year's support for this bill. Those of us practicing in the mental health professions need your help, but our citizens need it even more. We are being overwhelmed with requests for services on a daily basis. I and my colleagues are turning away many people a week with heartbreaking stories that we cannot possibly accommodate. You can again take a small step to increase the public's access to well-trained, qualified providers who can help us better meet the current needs for mental health treatment. I once again ask you to provide a favorable report on HB 26, which opens a bit wider the access to care door for mental health services. It is one additional small step to many that can increase access to care in Maryland. Thank you for the opportunity to speak to you today.
Delegate Hill.
That there had to be, in addition to the doctorate, to change into clinical field, 1,500 hours. Now you're coming back and asking for an internship, which is a lot more hours. Can you explain what happened between this year and last year, or why the internship is important? Yeah, why?
And it's the internship. Because the bill as it reads currently, it says 2 years of experience. I think the very last sentence. And so it's just replacing it to clarify that that should be an internship. Right, a clinical internship.
And just to follow up on that, Delegate Bagnall, you did not testify with amendment. Are you okay with that amendment?
Unfortunately, I had not had the opportunity to speak with Dr. Smith. I had reached out, but we hadn't connected, so I didn't understand the explanation behind the amendment or the additional hours, because I believe the agreed upon hours was 1,500 in our previous incarnation. So I believe that this is something for discussion, perhaps in subcommittee.
Wonderful. So, Dr. Smith, if I can ask you to meet with Delegate Bagnall and try to work it out before the bill is assigned to subcommittee, that would be wonderful. In addition, if an amendment is requested, make sure that Michelle gets it so she can get it to committee's council, okay?
Can I say something? Actually, it's not an addition. It's no additional. In order to become licensed, it requires 3,250 hours. 1,750 must be from the experience. That's the 2-year that's listed in the actual bill. 1,500 is actually an addition. It's just experiment. It can be it can be pre-doc, it can be post-doc. It's a combination of things. So the hours hasn't changed at all.
Okay.
It's the same amount of hours.
Well,
and all of the specialization programs that the board looked at, they actually have an internship. So it's really not an issue because they exist within that program anyway.
Well,
It's
I
just to be
know,
clear.
if I may, I know the sponsor really well, and she's so easy to work with. So if you can meet with her, that would be great. I'm pretty sure, I'll bet every dollar I have that you will come to an agreement, okay? She's great to work with, very easy. Any other questions? Delegate Rosenberg.
The legislative website, General Assembly website indicates there is no cross-file. Is that correct?
Correct. There was a miscommunication with our cross-file who did not put the bill in.
Okay, you're welcome. Any other questions for this panel or the virtual witness? Seeing none, thank you so much. And Dr. Smith, thank you for helping the committee work with these issues, okay? We appreciate you. Take care. Okay, we have next, Care First Blue Cross Blue Shield, Deborah Rifkin. Come on down. Yes, we'll have lots of questions for you.
Debbie Rivkin, Vice President, Government Affairs for Care First, Blue Cross Blue Shield. Happy to support a bill this year as my first bill before this committee. Care First is committed to ensuring, you've heard me say this over the years, to making sure we've got an adequate network of behavioral health care providers to meet the needs of our members. And in fact, we've made a concerted effort over the past 5 years to increase the amount of behavioral health care providers that we do have for our members. And I'm proud to report we've tripled the amount of behavioral health providers that we have today to see Care First members. And we've increased year after year the number of psychologists that we have in the network. As you've heard from the panel before me, there's clearly an unmet, there's not enough providers for the needs of the state citizens, and that is projected to continue in the years to come. I've seen reports that say up to year 2025 we will not have enough psychologists in the state. So Care First supports this bill as an opportunity to try to get more practicing psychologists in the state to help the needs of the citizens. Thank you.
Thank you for always working with this committee. We appreciate it. Are there any questions for this panelist? Seeing none, thank you so much. Appreciate you. Thank you. So this was actually the last witness on this bill. So this will conclude the bill hearing on House Bill 26. It is 3:30, right on time. Let's start with the Maryland Department of Health budget overview. We do not need to take a break. We're going to continue with the same link. I've been told it will work. So if you can come up, thank you. And thank you for your patience. I know you came early. And while we're waiting for the last bill of the day, which will be House Bill 103, we will do that after the briefing, okay? Thank you. Good afternoon. How are you? Who would like to get started?
I think we can jump right in. Do you want us to wait until you can see our
Oh, no,
analysis?
absolutely, yes, we'll wait.
Okay.
Take your time. Is there anyone else here that needs the chief clerk? Because they have gotten a few people. Anyone else? Seeing none? No. Thank you. Tell her thank you so much. So for our members, this is the part of the budget briefing that deals with health. So everything we pass here, they'll be able to address the expenses.
Gone 3 to 2. Okay, thank
I
you.
want to thank, if I may, staff. It's nerve-wracking, you know, when people are waiting. So I do want to thank you all both for being so patient, and I want to thank you for being patient as well. And welcome to our committee.
Thank you so much for having us. Madam Chair and members of the committee, my name is Morgan Smith, and I'm joined here with my colleagues Ann Wagner, Samantha Tapia, and Naomi Kimuro to present to you today the MDH overview analysis. We're going to try to walk through this pretty fast, so if at any point we're moving too quickly, just rein us in and we will slow down. Starting on page 2 of the analysis, you will see a 5-year funding trends for MDH. And in fiscal 2024, the budget decreases by $65 million or 0.33% to $19.6 billion. We're going to skip to page 4. On page 4, you'll see a reference to the planned reversions included in this analysis. In the fiscal 2024 allowance, there are 2 planned reversions in fiscal 2023 totaling $79.5 million in general funds. And this includes $69.8 million in BHA for Medicaid-covered behavioral health services and $9.7 million under Medicaid. The governor's allowance also includes deficiency appropriations totaling a net increase of $1.1 billion to the fiscal 2023 appropriation. Approximately $976 million of this funding covers provider reimbursements for Medicaid services, including those for behavioral health and the Maryland Children's Health Program. Additionally, there is $55.9 million for the Behavioral Health Administration, $70 million for Developmental Disabilities Administration, and $315,000 for the Public Health Administration. I will now pass this over to Ann Wagner, who will talk through some of the Medicaid-related COVID spending items in the analysis.
Thank you, Madam Chair. Moving on to the next page, page 5. So this exhibit is showing the federal funding coming into the budget in fiscal 23 and 24 from the enhanced federal match on Medicaid spending during the COVID-19 public health emergency. I believe you heard a bit about this earlier this week, but during the COVID public health emergency, Medicaid received 6.2% of an enhanced federal match above its normal 50% match. And that also allows the state to save general funds that they would have spent on Medicaid costs. And so the federal match was originally set to end in the last quarter in which the public health emergency ends, but the Consolidated Appropriations Act, passed in December 2022, instead phases out the enhanced match. And so that is why you're seeing fiscal 24 include some of this enhanced match funding as it phases out at the end of this calendar year. Moving on to the second exhibit on the next page. So this is showing Medicaid enrollment as a condition of receiving the enhanced federal match. Medicaid programs were required to freeze disenrollment. You can see that this caused a large increase in the Medicaid enrollment from fiscal 20 to 2023 year to date, about an increase of 24%. And like the enhanced match, the requirement to freeze all disenrollment was originally tied to the COVID-19 public health emergency, but again, the Consolidated Appropriations Act instead allows states to resume disenrollments beginning April 1st of this year. And so the fiscal 24 allowance is estimating that Medicaid enrollment drops by almost 10% due to disenrollment starting back up. And then moving on to the third exhibit, we wanted to also highlight different federal funding and special funds from the dedicated purpose account that show up in the MDH budget related to other COVID spending. You can see that the enhanced Medicaid match makes up the vast majority of this funding, but we also wanted to highlight that there's about $200 million in CDC and public health preparedness funding coming from the federal government. And then there's special funds distributed to healthcare providers. That includes hospitals, nursing homes, and assisted living facilities to respond to continued COVID-19 impacts in fiscal 2023. And then looking to fiscal 24, the amount of COVID spending drops significantly as that one-time federal stimulus ends and the state's response transitions to more ongoing activities. So I'm going to pass back to Morgan.
On page 8, you will see the functional breakdown of agency spending. As I said before, the MDH total fiscal 2024 allowance is $19.6 billion. Of this, roughly $16.1 billion, or 82% of the allowance, is used for provider reimbursements across Medicaid, behavioral health, and developmental disabilities. And we like to say that that pays for people's health care, so that's where the bulk is. The other 18% is utilized for contractual services, grants, and then in addition, salaries and fringe benefits for both regular and contractual employees, and then miscellaneous overhead. Moving on to page 9, pages 9 through 12 walk through the major changes in the department. You'll notice that this is by area. We have bold headers depending on what agency these changes are happening in. I'm just going to point out a few items of importance, and on page 9, under MDH administration, you'll see funding for the accelerated mandated provider rate increases. This is contingent on the passing of legislation that accelerates the minimum wage. If that legislation passes, additional funds for provider rate increases will be provided for behavioral health, developmental disabilities, and Medicaid administrations. Moving to page 10. Under behavioral health, you will see a line for the $70 million for behavioral health infrastructure. This is netted against $8 million in a deficiency for fiscal 2023, which I believe you've heard about in the DLS fiscal briefing. In both Medicaid and BHA, you'll see lines dedicated to utilization and enrollment funding changes. And otherwise, many of the major changes are related to the contractual services and provider rate increases. Most of these items are talked about in more length in the individual analyses, so if you have questions, we'd be willing to walk through those with you. Moving on to page 13. You will see at the top of the page a discussion regarding contingent actions. This is $50 million in general funds that will backfill an equivalent reduction in special funds from the Medicaid deficit assessment, and this is contingent on the passing of the BRFA at the end of session. At the bottom of the page, you'll see the beginning of our personnel discussion. Exhibit 4 provides information on the number of positions that are filled or vacant over the last 5 fiscal years at MDH. And in fiscal 2023, MDH saw the lowest total workforce and highest number of vacancies in recent years. Moving to the next page, page 14, Exhibit 5. You'll see a total number of filled positions across the department, and as of January 2023, each area of the department has more than 80% of authorized positions filled. To highlight some key numbers, the Public Health Administration has the highest vacancy rate among the MDH units at 18.5%, whereas BHA and DDA have the lowest at 6.78% and 10.34% respectively. After that section, we have a discussion of some of the higher vacancy rates. Several of the MDH hospitals have the highest overall vacancy rates, with Western Maryland Hospital Center and the Secure Evaluation and Therapeutic Treatment Program, also known as the SET unit, seeing 19.75% and 22.95% respectively. This suggests that while largely MDH is seeing a return to pre-pandemic norms, there may need to be additional assistance provided as it relates to vacancy rates. Moving forward, we see that MDH's high vacancy rate exceeds the expected turnover assumed in the fiscal 2023 budget. The average budgeted turnover rate across MDH is 8%, whereas the average vacancy rate is 13.6%. Because MDH has more unfilled positions than is budgeted for, MDH should be saving roughly $33 million that would otherwise have been used for employee salaries and fringe benefits. Moving to page 15, you will see Exhibit 6. We discussed the annual salary review adjustments made in fiscal 2023 that target positions that are facing high vacancy rates and turnover. In addition to registered nurses who received a 6% annual salary review adjustment, which positively impacted about 1,600 employees, there were other adjustments made to other classifications within MDH, and those are listed in Exhibit 6. I will let you guys read that at your leisure. And then lastly, on page 16, we have a short discussion about the Public Health Administration. As you may know, PHA has more than 15% of its positions vacant as of January 2023. And in particular, laboratory services had 34 vacancies, which accounts for about 17% of its total employee allotment. The Chief Medical Examiner's Office had 22.5 vacant positions, or 22% of their total allotment, with 7 positions that have been vacant for more than 1 year. This negatively contributes to the backlog of autopsy cases that the state has been hearing about for the last couple of years. Further discussion of vacancies, including those at the Chief Medical Examiner's Office, are discussed in the PHA analysis, and there's also additional information on personnel changes that are included in Appendices 3 and 4 at the end of the analysis. And with that, I'm going to pass it back to Ann to walk through some of our observations.
Great. So next up in the analysis, we could just highlight a few policy and budget issues for your attention. The first two relate to Medicaid's home and community-based service waiver programs. These are waiver programs that allow people who are not ordinarily eligible for Medicaid to receive state-funded or Medicaid-funded home and community-based services. And so those are nursing and case management, other services that can help individuals remain in their homes rather than move to a nursing facility or other health facility. And so to be eligible for one of these programs, there's a financial eligibility piece of it, and there's also a medical eligibility requirement that an individual require a level of care that would qualify them for a nursing facility or a different state health facility. And so the different waiver programs the state administers are listed on this page, and I will move on to the next exhibit, or the next page. So we just wanted to highlight a few of the waiver programs that have been reporting wait lists or registries. That's shown in the green bars on this chart. The largest registry is for the Community Options Waiver Program under Medicaid. Most recently, at the end of June 30, 2022, they reported a registry of over 23,000 people. And this is also a program that has been reporting the lowest utilization of its authorized slots. And so that's what the blue and yellow bars are showing, is that the program could have filled over 6,300 slots in fiscal 22, but as of March of last year, only about 71% of those slots had been filled. So the next page lists a couple different reasons MDH has given in the past for why it does not reach program capacity. That includes limited capacity among home and community-based service providers. However, the department has also reported having difficulties pulling people off of the registry and in an efficient manner, and then having to work through a complex eligibility determination process. I think especially related to that medical eligibility provision, has created a backlog in pulling people off the registry. The next exhibit, or on the next page, outlines the current triage process for that registry. I won't go through all these steps. I'll just highlight step 4, where I just want to highlight here that the registry process, individuals are added to the registry before their financial and medical eligibility are determined. And the time that happens is once an application is sent to them and a slot opens for them specifically, that's when their income and medical eligibility are determined. And so that has created a bit of a backlog with taking people off the registry. Exhibit 9 on the next page shows some of the results from MDH's outreach efforts for that registry. In 2021, MDH sent out 300 applications each month, but found that they would only have a return rate of about 33%. And then in the first 6 months of 2022, the return rate was lower at around 20%. MDH indicated a couple different reasons for people not applying, including the individual moving to another state or not being interested or needing services at the point when they were invited to apply. I will also highlight here that even though there is the low application return rate, the department has not been processing all the applications coming in each month. And so that's showed with the individuals enrolled and individuals denied. And so in 2022 so far, MDH has only processed an average of 13 applications each month out of 60 applications coming in. So there was legislation last year, Chapter 738, which requires MDH to double the number of applications it's sending out each month to 600. And with current application response rates, we estimate that that would add about 60 to 97 more applications coming in each month. MDH is still in the process of implementing that expanded registry outreach. It does require a change to their long-term services and supports IT system, and so they're still in the process of increasing their outreach. Another bill from last year, Chapter 464, also known as the End the Wait Act, required the department to develop plans to reduce any registries or wait lists under home and community-based service waiver programs by 50%. And so at the time that this analysis was drafted, the plans had not been submitted, but they were later submitted on February 1st. And so the requirement has been met, and MDH has submitted those plans at this point. And so that ends the first issue. I'll move on to the second issue that has to do with an American Rescue Plan provision that provides funding specifically for home and community-based services. So the exhibit on the next page shows the amount of funding. So the American Rescue Plan Act included a provision that states would receive a one-time 10% enhanced federal match on home and community-based service spending for 1 year. And so through this provision, Maryland is expected to receive $644 million. And it's split, you can see from this chart, it's split across Medicaid providers, behavioral health providers, and then the Developmental Disabilities Administration. Fiscal 22 budget language placed a requirement that federal funds coming from this provision be first retained by the administration that claimed those funds. And so the estimated $274 million or so collected by DDA must be retained under that administration. That budget language also required that 75% of the federal funds coming from this provision be spent on one-time rate increases. And so on the next page, there's a list to meet this requirement. MDH has implemented provider rate increases ranging from 5.2% to 5.5%. These are, they were set to continue through MDH reinvesting these ARPA federal funds. However, the department has indicated that they are going to make these rate increases ongoing. And so even after the federal funds have been fully reinvested, there will be an amount of state funds that backfills some of those funds. And so the budget is based on that and reflects this as it continues these rate increases beyond March 31st of 2024. And then moving to the next page, we wanted to highlight that the department has dedicated more of this funding to other emergency or temporary rate increases. And so this exhibit outlines some of those other rate increases. There's also an appendix that reflects this as a timeline to show when those rate increases are in effect. And then on the next page, we have an exhibit that shows the split between this funding spent on rate increases and then on other uses. And so I'll highlight that across the department, that 75% requirement has been met and surpassed. 92% of these funds are supporting provider rate increases. The other $53 million is being spent on certified peer recovery support services under the Behavioral Health Administration, and then $5 million for competitive provider grants to DDA providers. And so that concludes this issue. I'll pass it to Samantha to talk about our third issue in this analysis.
Thank you. So we include a little bit of a background on past efforts to tackle the opioid epidemic across 2015 through 2017. Just to review, the Heroin and Opioid Emergency Task Force, Interagency Heroin and Opioid Coordinating Council, the Opioid Operational Command Center, or OOCC, and the local opioid intervention teams were all founded and continue to work into the present. There was also legislation at the state and national level toward prescription regulation, naloxone distribution, and increased education efforts around opioid addictions. This also included, the response also included state opioid response grants, 2 blocks totaling around at least $167 million across multiple years, and a third block is in the fiscal 2024 budget at $38 million. This is apart from Medicaid reimbursements for a wide variety of addiction treatment and prevention services. Possibly in coordination or as a result of these efforts, there have been successful lawsuits and settlement payouts, which led to the establishment of the Opioid Restitution Fund, or ORF, in 2019, which has received at least a couple settlement funds so far. There are at least, in this fiscal year, there's $24.8 million from the Johnson & Johnson settlement, and $30 million will be from the Purdue settlement in fiscal 2024. This funding serves a variety of programs across the MDH system, but primarily in PHA and BHA, and separated pretty cleanly across prevention and treatment, prevention being in PHA and treatment being in BHA. But BHA definitely has a larger block at $375 million compared to 22.4 million in PHA. And then we have a couple of exhibits. First, Exhibit 14 on page 31 shows, next one, yes, the drug overdose deaths in Maryland includes opioids as well as other drugs. And as you can see, that there was a rise over the pandemic, and that has fallen over the course of 2022, which was also mentioned and recognized at one of the task force meetings in the fall. And this is CDC data. OOCC data provides the county level opioid-related deaths, also showing the decrease over the course of 2022 across most counties. The decrease is also seen in non-fatal overdose visits to emergency departments, and that decrease is even more significant than the decrease in opioid-related deaths. Again, the decrease is a good sign, but as the previous exhibit showed, this is still only a decrease down to pre-pandemic levels. And so the data will, ongoing data will tell us more whether that is related to pandemic or whether that is related to efforts, the funded efforts in Maryland. With that, I'll pass it back to Morgan to conclude.
And I think with that, that concludes our presentation. We do have some appendices at the end that I mentioned earlier that I will let you walk through. And then there is an update on the Cigarette Restitution Fund that I will also let you read at your leisure. But other than that, we are happy to take any questions that you might have.
Thank you. And thank you for your time and all your efforts. We really appreciate it. Are there any questions? I'm going to start with Delegate Bagnall.
Thank you, Madam Chair, and thank you for your presentation. And I'm going to preface this with, I don't expect you to be omniscient, but when we're looking at the drug overdose deaths, we were essentially flat for about 3 years, but it was double what we had seen previously. And I know that you said we're returning to pre-pandemic levels. Are we seeing any trends, any identifiable trends that will tell us the trajectory that we're going if we're looking at returning to sort of that flat but high rate, or are we seeing trends that we're on a continual downward?
I can't comment on an expert level, obviously, and I know the data is only through July of last year. So the data we get updated data through the OOCC and also CDC. I don't know what the delay is and how soon we get updated data as it's collected.
My pleasure. We have Delegate Hill.
Thank you. Thank you, Madam Chair, and thank you, ladies. So on page 15, I guess it's Exhibit 6, this dental hygienist 100% vacancy rate. Is this a new position? How do we get 100% vacancy rate? Is this a new position that we are just starting, or what's going on with that?
That's a great question. In the original data that we got, it said greater than 100%, and I
Wow.
took the greater than sign out because I couldn't explain it. So
We killed a couple of dental hygienists along the way.
yeah. So I can definitely follow up and get that information for you because it's still sort of a pending question on my end.
Okay.
But I do wonder if that is if that is a new position or if they've just had so many vacancies that they need to fill all of the positions.
Thank you.
But I will follow up with
All
you.
right, thank you.
Delegate Shalega.
Thank you, Madam Chair. Thank you all for being here. It's very interesting. Page 9 has the proposed budget, and I notice on there that the 22, 23, 24, the general fund numbers are increasing, but we're getting less than the special and federal funds. So, you know, I see there's a slight decrease from 23 to 24. Is this due to the federal pandemic money that was coming in, and are there some programs that are going to go away with that, like the increased Medicaid enrollment? You know, I'm just concerned that we're continuing to do this and the federal government is doing that, and
Yes, that's what's driving that trend, is that even though the total budget is in decline, you're seeing federal funds driving that, and then general funds are still increasing as the enhanced federal match we had brought up is being backfilled with those state funds. So yes, it is driven by the end of one-time federal assistance. That's what's happening, at least on these trends.
are you seeing that a deficit going forward or additional funding from the general fund? I mean, does it look like we're going to have to keep putting more general funds in it because some of this programming is going to continue?
I mean, I think overall spending is declining because of that Medicaid enrollment and utilization dropping by 10%. And so even though general funds are backfilling that, I can't say right now what we're forecasting moving forward, but at least that's why you're seeing the general funds jump up so much, is that backfill. So this is spending that's been happening. It's just been shown under federal funds in the prior years. And so, but overall MDH spending is decreasing in the allowance.
From the federal rate. Thank you.
Are there any other questions? Yes, Delegate Rosenberg.
Thank you, Madam Chair.
My
This,
pleasure.
I think, is a follow-up to the question that Delegate Zelega just asked. Who will not be receiving care in Maryland? What class of people or type of health care or income level will not be receiving care because of the end of the federal pandemic money?
At least in terms of Medicaid redetermination, that process, I believe you all heard a briefing on that earlier this week. But that is driving the enrollment decline in Medicaid. And so those are individuals who signed on during the pandemic while there were no disenrollments. And so at least in the beginning, there will be people who are ineligible for Medicaid but have been kept on the program throughout the public health emergency. And so that will be that enrollment utilization decline is just based on redeterminations resuming.
I think
Who are eligible, these are people who you said are ineligible but were allowed on during the pandemic.
I think that it's too early to say how the redeterminations will all play out. That's still something that we're forecasting and projecting. We don't know exactly, at least in terms of eligibility groups. I think the ACA expansion group made up a large share of the increase in enrollment. And so at least we're projecting that that group might show larger declines since they were the ones coming on during the public health emergency. But in terms of at least the budget's set on a 10% enrollment decline, but this is something we'll be watching very closely moving forward on how enrollment changes as redeterminations start back up.
Delegate Gazzoni?
Thank you. Just following up on the 10%. So is that what in my prior NASA we would call swag, or is there some actual expectations around the 10%?
For that, the home and community-based service. Oh, I'm sorry.
Sure.
Sorry.
No problem.
I wasn't sure what you were referring to. That is, let's see. I mean, that's just the estimated decline. We've been trying to, that's how the budget is set up, the allowance coming in. But we will be doing projections to, further kind of flesh that out and see kind of as redeterminations start back up, what is the estimate for how many people are likely to be disenrolled? We'll be working on that. Yeah, oh, absolutely. This is just a projection.
Kind of either way.
Yeah, it's not, right, it's not a problem. I mean, that's what the budget is set on, and every year there's adjustments made to the budget based off of finding out new information later. It's all based on projections, and so even this year there's a deficiency because the public health emergency was extended, and so the budget originally last year passed expecting redeterminations to start sooner, and so that had to be adjusted. So right now it's based on 10%, but yeah, that's a projection.
Any other questions? Seeing none, thank you for your patience and thank you for the work you do for us. You have a blessed day. For the committee, we're going to go to the last bill hearing of the day, which is House Bill 103, Delegate Bagnall, State Board of Social Work Examiners, temporary license to practice social work. Will you be so kind and bring your panel, please? Thank you. Thank you. Yes. You can stretch for a minute, right? You can get up and stretch. Yeah. Yeah. I remember that.
Presentation traumatized me.
Good afternoon, Delegate. Would you like to start with your testimony while your panel comes up?
Thank you, Madam Chair. And good afternoon, Madam Chair, Madam Vice Chair, members of the committee. Once again, for the record, I'm Delegate Heather Bagnall, District 33C, Anne Arundel County, here on behalf of HB 103, State Board of Social Work Examiners, temporary license to practice social work. House Bill 103 will look somewhat familiar to this committee. We have had this bill in various forms since 2021, when it originally passed both chambers. As this committee will recall, during the COVID-19 pandemic, testing centers were forced to close, preventing social work students from taking their final licensing examinations. This significantly limited work opportunities for students, prevented employers from being able to employ enough workers, and created an additional burden to care for Marylanders. Last year, as we considered the bill, once again, we were recovering from a cyber attack, malware attack, which significantly impacted our health department for months. This bill was a reaction to the delayed testing, which delayed licensure for social workers during the COVID crisis and created a significant backlog even once the test came back online. House Bill 103 will permit the State Board of Social Work Examiners to issue temporary licenses to practice for applicants who, except for passing an examination, have met all other education and experience requirements to be licensed as social workers. We have provided a sponsor amendment which, in the event of administrative delays, puts the discretion to exercise this rule entirely with the board, who may, if deemed appropriate, issue a temporary license if the examination is unavailable to an applicant for at least 7 days. Further, the license would be valid until 180 days after the examination becomes readily available. You will see in the testimony that the Board of Social Work Examiners maintains their opposition to the legislation. We have continued to engage to attempt to address the concerns of the board and conveyed our intent that this bill provide a behind-the-glass discretionary tool should another unique emergency situation arise in future where it would be required, but we were unable to come to consensus. The bill stipulates that a temporary licensee may practice social work only under the supervision of a board-approved supervisor while the temporary license is in effect. Furthermore, the board maintains authority to restrict or regulate the temporary licensed social workers. Though this bill will not solve the workforce deficit, that we've heard so much about. It will provide a discretionary tool in case of emergency to address future unforeseen challenges that might prevent further getting qualified social workers into the field. If there is an overarching lesson from our health crisis, as well as recent malware attacks on our infrastructure, it is be prepared. We cannot assume that every crisis will occur during our 90-day session when we can take action, but rather we need tools readily available to respond. House Bill 103 is one such tool and is consistent with other efforts to expedite health care licensure during the COVID crisis, and I respectfully request a favorable report on House Bill 103.
Thank you. Who is next? And you have 2 minutes. Will you be so kind and thank you? You can get started.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Teresa Hessler, and I am here today representing the Maryland Association of Resources for Families and Youth, also known as MARFI. The members of MARFI represent providers who serve Maryland's most vulnerable populations who are in and out of home placements due to abuse, neglect, or severe mental health and medical needs. Our members are social workers, operate group homes, treatment foster care programs, and independent living, primarily serving the foster care population as well as the juvenile services program. We are here today asking for your support on House Bill 103. If passed, this legislation would authorize the State Board of Social Work Examiners to issue a temporary license to practice for a period of 180 days. At this point, an individual has already completed their schooling, their training, completed requirements, and passed a background check. They would still have to practice under a licensed social worker approved by the board while with this temporary license. As you will hear from many others here today in support, this is just another practical tool in the toolkit for the Board of Social Work Examiners to use if the exam was unavailable due to unforeseen circumstances, such as another public health crisis or a malware attack. It is for these reasons that we are politely asking for a favorable report on House Bill 103. Thank you.
Great time. Follow that. Who's next?
I will try to follow that.
I know you can do it.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, committee members. My name is Steve Acerno. I'm the Director of Treatment Foster Care at the Arc Northern Chesapeake region. We serve children and families from all across the state. I'm also a licensed social worker for the past 20 plus years and also a board certified supervisor. What we're talking about actually already exists, that we have individuals who have completed their schooling, who are able to enter the workforce, but they can only do that in the public sector. So they don't have the title as social worker. They're given another title, but they're doing the same work as a social worker does. And so we've had conversations with the board on several different occasions to talk about the issue. One of the concerns that they brought up to us was that it's a public safety issue, which we disagree with. This practice in terms of the public sector hiring folks without a license has been going on for years, and there's no data or evidence to suggest that there's a safety risk. And those individuals who start non-licensed eventually do get licensed and continue their good work as social workers. So for those reasons, I ask that you approve this legislation.
Excellent. Look at that. 35 seconds. Go ahead. Who's next?
I'm going to beat that number.
I know you can. Go for it.
Good afternoon, Madam Chair and Madam Vice Chair and members of the committee. My name is Simone Bramble. I'm the Executive Director of Presley Ridge. We're a nonprofit organization that serves Maryland's most vulnerable populations, providing treatment foster care service, independent living services, as well as workforce development across the state. I'm going to be brief because Delegate Bagnall did such an incredible job of summarizing the bill. So you'll hear from the opposition, and that is the Board of Social Work, that there is an objective determinant, and that is the exam that we are leaving out as it relates to giving temporary license. What we know now, the ASWB, which is the Association of Social Work Boards, dropped a report, an analysis last August regarding the licensing exam for social workers. What we do know that there are a lot of disparities, and particularly as data is disaggregated by race in terms of test takers and who passes and fails the exam. And what we see is that a disproportionate number of people of color who are failing the exam at alarming rates as it relates to or compared to their white counterparts. So using the exam as an objective tool is not something that we can do anymore until we can really determine, what's behind, those disparities. For us, as providers, and I'm a clinical social worker, I've been practicing for a number of years, experience matters. The board will tell you that folks who are applying for a license at the LMSW level or the bachelor's level don't have social work experience. I beg to differ. As someone who worked before going to grad school to get my social work degree, I came into the field with experience. I also worked while I was in graduate school. So there are a lot of lived experiences out there for many, many social workers that we can't disregard. And for those reasons, I urge you to make a favorable report for this bill. Thank you.
Didn't do it, but not even with a lawyer would you do it. I'm kidding. You did well. Who's next?
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Nicole Smith. I am a licensed social worker, and I am here on behalf of an organization called the Board of Child Care, where I'm the executive director. The Board of Child Care is a nonprofit headquartered in Maryland that provides human services to families, arguably the most vulnerable families. Last year, we served 1,300 families throughout our Mid-Atlantic footprint. And with our opportunity to serve across state lines, we've also had the opportunity to see best practices in other areas. In West Virginia, they have already adapted a similar bill to this legislation we're talking about today that allows for temporary licensure. That practice has allowed for service to continue during the COVID-19 pandemic without interruption. Board of Child Care, as my colleagues have talked about, depends on the skills of licensed social workers to deliver our critical healthcare services. Over the past 3 years, my organization has been challenged to hire licensed social workers, both at the master's level and advanced level. That has really impacted our ability to deliver services. We've had to cut our services by more than 50% in some situations. And these are really critical, unique treatment options to survivors of human trafficking and others that don't exist for youth. We might be one of the only 2 providers in Maryland. So to have to cut our capacity really creates a tax on our child welfare system. And just in our current national workforce crisis, we just want to make sure we have the tools. We know this is not going to fix the crisis, but to allow us for another option. And for that reason, I ask for a favorable result.
Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, and honorable members of the committee. My name is Ari Plout, and I'm here on behalf of Presley Ridge in support of this bill. Thank you, Delegate Bagnall, for sponsoring this piece of legislation. I just wanted to focus my testimony on how other states operate in a similar sphere. For example, many states, to our account, after doing research, about 24 states or so have passed some form of temporary licensure for social workers. For example, in Indiana, they have a temporary permit for up to 12 months or until you pass a test, and it will allow a temporary license to practice prior to passing the examination, which is analogous to what we're attempting here. In addition, in Connecticut, the department may issue a temporary permit to an applicant for licensure as a master's level social worker who holds a master's degree from an accredited social work educational program, but who also has not taken the licensure examination. So as you see, this would not be a new precedent that we would be setting here in Maryland. And finally, I just wanted to touch on the fact that the Board of Occupational Therapists as well as the Board of Nursing in Maryland do have the tool to issue temporary licenses. So in conclusion, I thank you for the time, and I ask for a favorable report on this bill. Thank you.
Good afternoon, Madam Chair. Fine, glad to be here. Yep. Madam Chair, members of the committee, I'm Frank Boston III. I'm here on behalf of Presley Ridge and the coalition, and we thank you for listening to us on this last bill this afternoon. Special thanks to our sponsor, Delegate Bagnall, who really said it all. We really didn't have to testify. She was so great. Thank you. And Madam Chair, thank you for allowing us to testify. You know, as it has been said, our theme is this bill is just a tool in the tool chest. And it's really, as amended, just a tool because it's a May. And we went back and forth, and the good delegate put us all together so that we can work things out. So we changed the shall to a may, and means the Board of Social Workers Examiners can use this as they see fit if there is an administrative delay. We even narrowed the definition to make it specifically clear that the administrative delay we're talking about has to do with the unavailability of the exam. So that's a part of the amendments. So hopefully they will use it. Hopefully they will see it as the same way we do. They get backed up and there's a delay, that this is a useful tool that will help move things along. Regarding the issue of the public safety crisis and issue that was articulated to us in our meetings with the opposition, we agree, but we see it from a different lens. We see it as a public safety issue when you have children sitting, having to stay in hotels, or you have children having to stay in the offices of the Department of Social Services because they can't be placed because there's not enough social workers, because, and we see it, because these temporary licenses are not issued to allow the ratio of social workers to students to fix that problem. So we really see this as a useful tool, and we hope the board will get that way too. Thank you, Madam Chair and members of the committee. We ask for a favorable. Thank you. Yep.
Thank you, Madam Chair. The gentleman testifying last, I think I might understand the bill a little bit better, because this bill was originally created when we had COVID and the test wasn't available. We had a work shortage. Now I'm just trying to make sure I understand the bill. So now we're going to offer temporary licensing even though the test is available. My question is, what happens when the applicant fails the test? And also, how long is the waiting time and period if a person wanted to take the test like today? How long would they have to wait to have that scheduled?
I've been waiting for that question. We actually, I thought we were going to get it in the Senate, and I was going to use it as part of my testimony. So yeah, it's really a great question, and in a lot of meetings it came up. So the temporary license is good for 180 days. Just remember that part. If you sit for the exam, let's say you get a temporary license, and all right, you get the exam. You sit for the exam, okay? Let's say you fail. If you fail, you got to wait 90 days before you can take the next test. So within that 180 days, which is the lifespan of the temporary license, at best, you get to take the test twice. And that's assuming that you took it on the first day and then took it on the 90th day. So as a practical matter, you can take the test, and if you pass it, great, no problems. If you take the test on that 180 days and fail it, as a practical matter, you can't keep practicing until you take the test again, not even on a temporary license, because of the 90-day wait period. Yep.
Delegate Hill.
Thank you. Just to clarify, what the bill says is that they may issue for people who do not have access to the test for whatever reason. It doesn't say for people who have failed the test. And we already allow people to practice under this reduced license or temporary license in public sector.
Very good point. That's to Steve's point. The irony of this whole thing is, if you work for the Department of Social Services, you can do the exact same work without having sat for the exam, and you can do it for 180 days. If you're a private sector, like our team up here, because of the regs, You cannot practice. And we're just saying, hey, give us a temporary license. Put us on the same level playing field that the people who work for the Department of Social Services who are doing the exact same work, and they can do it without a license, let us be able to do it without a license for 180 days. And that's not to say, Delegate Dr. Terrio, that's not to say that we don't believe in licensure. We do. And everyone here at this table has their licenses and higher education licenses. We're just saying, put us on that equal footing with the public sector and give us a chance to take the exam. Yep, thank you.
Hutchinson, followed by Delegate Taveras, followed by Delegate Collison.
Thank you, Chairwoman. This may, I guess, for Delegate Bagnell, and as I'm reading through the testimonies and the opposition letters, and I see that the State Board of Social Work Examiners, as well as the Office of Public Defender, are opposed. And in our spirit of compromise, are you working with them? Is there a compromise that you're working with them?
Yes, we have actually been in conversations around this bill for 3 years. We have gone back to the table. We've had 2 or 3 meetings already trying to get some consensus language and ensure that the intent of the bill, as well as the actual crafting of the bill, is clear for all parties, all stakeholders.
But you also mentioned there is a shall or may. That's not enough. That's not solving the issue, I would take it.
We actually amended this bill to shall last year, and it was still opposed. So I think there is a philosophical difference in our ability to find compromise. But we continue to try. But we will continue to try.
Yeah, the change to May was an attempt to appease the opposition, because now it's in their discretion, and it was made clear to us in our conversations that were brokered by Delegate Bagnall, and also when we met with them on our own, that the issue of taking away discretion, and the issue of that they may have other delays that don't have anything to do with the test. And we said, we hear you. So it's a tool. You can use it if you want. If you don't, you don't. Hopefully you will see that it's a useful tool. But the amendment that has been offered is change the shall to a may, as it pertains to the administrative delay part of the bill. Yep.
And let me ask a question about the amendments. I don't see them in the file. Are you working on it, and you will be submitting them to Michelle Furman to submit to council?
Yes, we actually had submitted them to drafting, and we were under the impression that they were on the floor system, but then we realized that we hadn't submitted them independently to Michelle Furman, so we have sent them actually during the hearing.
And I have copies. I drafted if you need it. Yeah, but we'll get them.
So can you make sure, follow up with Michelle?
Yes.
Yeah.
Thank you so much. I have Delegate Taveras, followed by Delegate Collison.
Your question was it? Okay. Thank you, Madam Chair. I think my question is for Mr. Acerno. Is that right? Yep. Okay. So I want to preface it by saying I understood that you work in a setting where temporary licenses are granted, and if so, can you tell us how many issues of incompetence you've had with those folks with temporary licenses?
So I actually don't work in a setting that issues it. I work in a private nonprofit, so we don't have that opportunity because by regulation, we can only hire social workers who are licensed.
Who referenced the allowance of temporary licenses?
Right, so that happens on the public side. So for the different local departments of social services in every county, they have that option of hiring people. They give them a different title. I used to work in that system. So that's why I'm familiar with it. They give them a different title, but they're doing the same work. We share the clients. It's the same work. They're just given a different name.
Any other questions? Oh, Delegate Woods, go ahead.
Yes, thank you.
this is my question. Have we not noticed over the years, in the context of social work, we see these positions, social service assistants, community support workers, family support workers. It seems to me that over the years, these positions have escalated whereby these individuals are actually doing more of the work of social workers. And it does not appear to be acknowledged as such. They're literally doing jobs that, you know, when I started out in social work, there were things that they could not do. And today, they're doing things that social workers are doing. So is anyone taking that into consideration, that we are seeing an increase of responsibility also because we see this deficit in social workers?
Thank you for that question, Delegate Woods, and you're absolutely right. We provide transitional age youth services in our independent living program, and a lot of our staff who are not licensed, they provide the bulk of the work. They're actually the backbone, of our service delivery. They work day in and day out because we run a 24/7 program with our young adults. And there's another issue, and not for this committee, but simply because of the regs. What the regs stipulate is that, to working in that environment as well, you have to have a social work degree. And we know that you don't need a social work degree to do a lot of the work that many, many people, family workers, are doing, across the state in these programs.
I have a question. How is it that the government is able to hire people and offer what you're asking for here when we're not able? Is there a government exemption? Do you know?
I didn't hear the last part of the
Is
question.
there an exemption for people that work for the government?
Steve?
I'm not sure of that. I think the difference is that they're called casework specialists. So they work under that title for the 6-month period, assuming that they're going to sit for the exam and pass the exam. Once they do that, then they're called social workers all of a sudden, but they're doing the same work.
For this panel? Seeing none, thank you so much for your time and for the work you do in our community. Next, we have 2 more witnesses, and one is a favorable with amendment. That is Mary Beth DiMartino, the National Association of Social Workers, Maryland chapter. Good afternoon, how are you? And thank you for your patience as you wait.
Thanks for having me. Good afternoon, everyone. My name is Mary Beth DiMartino. I am the Executive Director of the Maryland chapter of NASW, and I'm also a licensed clinical social worker. And prior to coming to NASW, I did work 30 years in child welfare, so it is something near and dear to my heart. I just want to thank Delegate Kelly and Delegate Bagnall. I know you guys very much care about the social work workforce, and that you guys have been working really hard on this issue for a long time, so thank you for that. And I am here today to request that you support this bill with our requested amendments from NASW. We have just requested that the wording be restored to the original bill that we had last year, that would allow the Board of Social Work examiners the ability to issue temporary licenses to qualified applicants if the test is not available. I know many of you are probably aware that there are a lot of issues right now with the Association of Social Work boards. Right now, there is some concern about the bias of the exam, and we are working with all of our stakeholders in Maryland. We are working with all of the social work community partners at the state, at the local grassroots, at the deans and directors, all of us, to look at root causes of this and to address the issues impacting this exam. But we do support the temporary licensure being available to social workers if the exam is not available. And COVID has proven that that is something that can happen. And last year, there were issues with computer technology issues that made a backlog happen. And so we are very, very concerned about the workforce shortages among social workers. And as others have said, there's precedence for this in other states and among our colleagues at occupational therapists and other boards in Maryland. So I do urge you to support with our recommended amendment. So thank you.
Are there any questions? Delegate Taveras.
Thank you. I'm actually really happy that you raised some of the issues. This morning, we got bright-eyed and bushy-tailed to discuss some of these very issues that were confronting the social work industry. And one of them that was highlighted was this existence of a report that highlighted the disparities. And I don't know if everybody, I mean, I wasn't aware of this, and I don't know if any of the other people here may be aware of this, but I mean, it may be worthwhile to kind of repeat, maybe for the listening audience, what it is that we're referring to, that we may have literally 20 to 30% disparity gaps in racial hiring of groups, so that we could provide more culturally competent care. Thank you.
Thank you for that, yes. And I know many of you were in the Black Caucus meeting this morning, and there were some really heartfelt testimonies and things shared, and we have been meeting with focus groups since September around this issue, doing town halls, talking to folks. It is very distressing to hear people with PhDs who've taken this exam 17, 18, 19 times, really struggling. And we are doing short-term and long-term things at NASW to address this, to create supports for people to have assistance. We're offering free courses to help people pass the exam as long as the exam is still the law in Maryland. We're doing boot camps and things to help people with the costs. We're creating a scholarship fund to help people with the fees and doing the things we can. And we're trying to engage with the ASWB as well to help them understand how people are really being impacted by this. And it is very distressing. And, I do encourage you, if you didn't see the remarks this morning, you can definitely watch that and see it is very distressing. There is obviously disparities between white exam takers and people of color. And there are a lot of concerns with the exam. And so we are working very hard to address those and to try to support people as much as we can at NASW and to address the issues from a grassroots level, both short-term and long-term. So thank you for your question.
If I may give you the numbers, the largest disparities between white test takers, 84% of whom passed the exam the first time, and black test takers who pass on the first try is just 45%.
Yeah.
There's a big disparity, and the report is really very good, very well written about the problems with the test. As a matter of fact, Senator Washington has a bill that is going to be dealing with this issue this session that I know the Black Caucus is very interested in passing. Delegate Collison.
Thank you, Madam Chair. I'm just hopping back to something I think I heard you say.
Mm-hmm.
You said as long as the test is required in Maryland. Are there states where it is not required?
There are. Yes, there are. And so there are different ways that different states are addressing this issue and going about credentialing folks. And so we are willing to, we've started coalition task force to talk about these issues. I'm happy to present what other states are doing, the data that we have. We want to solve this and engage in coming up with the best way to evaluate the competency and safety of social workers. We have a workforce shortage, and I think you guys know that social workers are needed more than ever. We have a mental health crisis, not only in the nation, but in Maryland. This is a barrier to getting people licensed to work with people, and we need affirming care by people who look like people who are being served, and we want to create a pathway, not barriers. So please let me know how I can support you guys, and thank you for supporting the work we do.
For your openness and your testimony and the work you do, which is not easy. We appreciate you. So I don't see any other questions. Just want to thank you for being with us today. I really
Thanks for having
appreciate
me.
you. The next person we have in the last witness for the day is the Board of Social Work Examiners. Ms. McClellan, how are you?
Good afternoon. I'm good.
And thank you for waiting. I know you are our last witness, and we appreciate your patience.
Thank you. Madam Chair and Madam Vice Chair and members of the committee, I'm Dr. Daphne McClellan. I'm the Executive Director of the Board of Social Work Examiners, and I'm here today in opposition to House Bill 103. This particular bill has nothing to do with whether or not to use the exam, as you were previously discussing. And actually, it has nothing to do that will help address the child welfare workforce concerns of its advocates. I would like to focus on two issues. First, this bill is predicated on the idea that applicants would receive a temporary license based on their education and experience. However, the LBSW and LMSW licenses are for mostly people who are just out of school and have no experience. Secondly, a tool in a tool chest that's been talked about is optional. You get to pick which tool to use. This language in this bill states that we would be required, we shall issue a temporary license if an unforeseen circumstance, act, or occurrence prevents an examination from being available in 7 business days. And then it states that the temporary license would be in effect for 180 days after the exam becomes readily available. This language is very individualized. What does it mean that the test is not available for 7 business days? Are we talking about it's not available to anyone, as is the case during COVID? For 2 weeks, the Pearson VUE centers were closed. Or are we talking about an individual applicant can't find a test appointment available in the coming week? Conversely, what does readily available mean? What does it mean 1 or 2 test appointments are now available, or does it have to be a dozen test appointments for that person to choose from? How does our board keep track of the arbitrary start and stop dates of this 180 days? We have an average of 900 people sitting for the LBSW and LMSW exams each year. Our board does not have the staff to deal with individual requests for a temporary license from every applicant who considers their situation to be an unforeseen circumstance, act, or occurrence. I urge you to vote no on this well-meaning but poorly conceived and written legislation. And I'm ready to answer any questions you may have.
Social worker?
No, just me.
Okay. All right. Thank you. So are there any questions? I'm going to start with Delegate Johnson, followed by Carlson.
Thank you, Madam Chair.
My pleasure.
So you've heard the discussion we've had here today.
Yes, sir.
So would you be okay with changing the word from shall to may, so they could use it at their own discretion?
Well, I have a copy of the amendment here, and it only changes the word on the part of the bill that talks about an administrative delay. So it says in the case of an administrative delay that it would be may, but then on the rest of the language that I read out loud, it still says shall. So it's not changed there.
So would you be okay with the word may throughout the bill?
The word may would be better than the word shall.
That really wasn't the answer, was it?
I am the administrator and I'm not the board. So, the board would have to talk about their position. Thank you.
Allison.
Thank you, Madam Chair. Thank you for being here. Good to see you again, Daphne.
Nice to see you.
Can you talk to me a little bit about the procedure for the entry-level licenses? And I'm especially interested in whether or not there's a clinical practicum before you become eligible for a license. I'm a speech pathologist, and I know that I had a number of hours that I had to complete before I was even eligible to be certified.
Right.
So can you speak to that?
Sure. And I also taught social work for 20 years, so I can speak a little bit about the education. So the LBSW, the Licensed Bachelor Social Work, and the Licensed Master Social Work are the entry-level exams for people who then want to practice. And we have two ways of applying for that. So one of the advantages that we have in Maryland that not every state has is we permit students to take the licensing exam during their last semester of their program. So if you're in your last semester of getting your bachelor's or in your last semester of getting your master's, you can go ahead. All you have to do is fill out the online application on our website, and pretty much immediately, as soon as we see that, the permission is granted to sit for the exam. You just indicate that you are a student in your last semester. If you, and so we have no backlog of people waiting, you know, to be approved to take these exams. For people who've already graduated, when they apply, they have to submit a transcript, which takes a little bit longer, and so it takes about 2.5 weeks for us to apply to approve people who are applying who have already graduated. So what is required to actually be granted the license, in addition to passing the exam, is that you have a bachelor's degree or a master's degree in social work from an accredited institution. And so if you, and a background check, the degree, the background check, and the exam. There is no clinical practicum. As part of social work education, you have an internship. For a bachelor's degree, you have an internship in your senior year of your program. And so I think it's 2 days a week that you go to a placement and you are in that internship. For your master's degree, if you don't already have a bachelor's degree in social work, you're in a 2-year master's program. So your first year, you have a 2-day-a-week internship, and in your second year, you have a 3-day-a-week internship. Whether or not those internships are clinical is really up to your what kind of student you are. So some social work students are on a clinical path. Some schools are more clinical than others. So you might be doing any kind of thing. I mean, and some internships are wonderful. I was a field liaison for many, many years for the University of Maryland School of Social Work, and then also at UMBC. And some students have wonderful internships and some have crappy internships. It's just, I mean, I hate to say that, but you're just competing with every other school of social work in the state, trying to find places that will take your students. So even though we would like to think that every student who graduates walks in with this wonderful experience, not every student does. And so that's why it's a little scary to us, or a lot scary in some cases, to just say, oh yes, here's your temporary license, go out and practice social work, because there is no real experience required in order to get that first degree. It's just that first license.
Any other questions? So I would like, if you will be so kind, and sit down with the bill sponsor and try to see, look at the language, see if there's some compromise. I understand your position, but I also know that we have a work shortage. I also know that Black people it's very tough to pass that exam. And I know for a fact that a test does not determine what kind of work you can do. I took the bar exam 3 times before I passed. And when I was at the U.S. Attorney's Office, I got the awards every month. So I don't share that often with people, and I had a language barrier. So I would like to see if there's some compromise that you can pass and you can come to until we can figure something out. I know Senator Washington has has a bill, 2 bills across the street. So we will wait to see how it goes, and we will like to come up with some solution. And I know that the Black Caucus is very committed to doing that. I appreciate your work and all your efforts, and thank you for having an open heart to finding a solution. You have a great day.
Thank you. Thank
My-
you for letting me testify today.
My pleasure. And this is the conclusion of the bill hearing on House Bill 103. For the committee, if I may, we have a weekly review meeting right now, and you're going to get a link for the subcommittee chairs, Delegates Morgan and Delegate Kipke. If the link will be sent to you by Michelle. The rest of you, will see you tonight, and thank you for your patience. It was a long day. We're gonna get used to it because we have longer days coming, okay? Take care. Bye-bye. I want to thank staff for your work.